After 12:15, so we will, we're just doing minutes first. So we'll go ahead and convene as the Board of Health. And our first item on the agenda is the January 17 minutes, which I see we have.
My only comment is the minutes both list me as excused and present. And
Yes,
I was not present.
Yes, thank you.
I am good at being in two places at once, but I was not on that day.
Well, that was tricky of one of us.
So Josh, we went ahead and convened. So we're just on item number 1, which is approval of the minutes. So we're just looking through the minutes for a minute before we get a motion.
I move to accept the minutes as amended today.
All right, we've got a motion on the floor. Any public comments on the motion? Any board or staff comments on the motion? Seeing none, all in favor say aye.
Aye.
So moved. All right. Now we move on to item number 2, which is to authorize the chair to sign the Public Health Emergency Preparedness Communicable Disease Response Annex Checklist. I guess Hickey's going to walk us through that. That's where our chair is.
So I'm Leah Hickey with the Public Health Emergency Preparedness Program. I'm the coordinator, and I am asking the board to authorize the chair to sign this checklist. And what it is it's a grant requirement for the Public Health Emergency Preparedness Grant. It comes from DPHHS, and it's meant to ensure that we have specific elements in our communicable disease reporting protocols. If you look on the first page at the bottom, I listed out the different sections refer to different protocols. So section 1, the public health surveillance and case response policy and protocol of ours, covers everything that's in there. And this talks about how reports are reviewed, how quickly they're reviewed, how we conduct active surveillance. I'm not going to go through every single thing in there. There's a lot of stuff. But I'm just going to...
I'm sorry, I'll just alert you all that Leah updated this checklist for us this morning, so you have a newer copy here at the tables than the copy that was sent to you in your print text.
Could I give you some background for those of you that are newer to the board? The State Health Department, who manages the Centers for Disease Control, contracts for this work down to the locals, requires this checklist. The history really is that we don't have engagement across the state at all the local county levels like we have in Missoula. And so this was one way of making it a requirement that they could assure that that engagement happened. So for those of you who've been on the board for a while, you see this every year. It's a little bit pro forma, but we're glad to answer any questions for newer folks about what it really means.
And if you were here last year, it hasn't changed at all. It's the same as last year.
Yeah. We've pretty much moved to the yes column over the years, and now we have in place all those protocols.
And none of the attached protocols have really changed in the last year. Right?
Not really. And they're all attachments in our communicable disease response annex of our emergency operations plan, too. So they function separately, but they're all attachments.
Which you did approve Leah's revised version of the emergency operation plans a few months ago.
Yeah.
This summer, right?
I have one question. The difference on page, on the front page where you kind of use this local notes to say team approach to infectious disease, and on the back on section 3 it says your agency's EPI team approach. So is that EPI defined somewhere?
Oh, epidemiological team.
Okay, and that language comes from DPHHS?
Yeah, it's shorthand.
Okay.
It's shorthand.
Thank you.
How often does the CDC issue changes to this?
The CDC doesn't actually change this. This is a product of the state's
Okay, so the state,
interpretation of
okay.
and then trying to get the locals to comply with the spirit of what the grant requirements are.
So does that mean you guys don't really have a whole lot of input on what's on this sheet? You just have to make sure it gets to yes?
Yeah. Yeah, I mean, we have informal input. We can go, what does this mean? Or why did you say it this way? We also have formal input every year that the grant is released, but that's largely on the deliverables.
Sure.
So-
Your responsibility is just to make sure these are actually included in your protocols.
To work toward them if you don't already have them. So early on, it was kind of a work plan and an assessment tool at the state level.
I would make a motion to authorize the chair to sign the Public Health Emergency Preparedness Communicable Disease Response Annex Checklist.
Thanks. So we got a motion on the floor. Any public comment on the motion? Any board or staff comment on the motion? Seeing none, all in favor, say aye.
Aye.
So moved. Next, we move to item number 3, which is accept performance management report. And Christy Shields is going to lead us through that.
Christy, are you going to give a little background how this fits in? You're going to do that? Okay.
No, I'm afraid we did not get it loaded.
Okay, pictures?
Oh, that's okay. I can, might be able to get that. I'm sorry, with moving rooms, the computer doesn't always recognize people as easily if you don't regularly log on, so we just have a little bit of slowness with that.
I'll just pull this up and talk about it. Hi, I'm Christy Shield. I'm the Performance Management Quality Improvement Coordinator, and I'm here to give a brief overview of the 2019 Performance Measures Report. You've all received that in your packet. Performance measurement is defined as the regular collection and reporting of data to track work produced and results achieved. And essentially what we do here, it's just a way for us to manage the work that we do and find ways to hold ourselves accountable to that work. In the greater public health context, this allows us, it gives us information where we learn what's proven effective in terms of public health outcomes and ultimately improves the community that we live in. In each year here at the health department, staff updates their data on their chosen performance measures. And these measures were initially selected through a process that we go through with each staff, each program area, where they answer the questions: how much did we do? How well did we do it? Is anyone better off? And this exercise allows staff a framework for selecting their measures, and we want to make sure that they're relevant and the data is easy to track and they're useful and relevant, meaningful for their program. The program staff oftentimes selects measures that have established state and national benchmarks, but they also select measures based on any alarming trends that they might see in the community. An example of that is the new measure that's included this year on youth e-cigarette use. That was included because we've had some really dramatic increases in youth e-cigarette and vaping product use in Missoula County, and we want to keep our eye on it. We strive for performance measures not to be viewed as an add-on for staff, but something that's just part of our regular work. It just kind of naturally fits into things. We want it to help our staff to learn how well their programs are doing, but to also help supervisors and managers understand the outcomes and metrics that they're accountable for. And there's a lot packed into this report. It's just really a way for us to track data through time. Essentially, we're looking at, we have a baseline and we track the measure. We have the measure type, which is output, process, intermediate, or long-term measure, and I'll go into that in a bit.
baseline and reporting year data, a graph that captures all years the data is tracked, as well as the target and where we're at this point in time. We also have included new performance measures and any measures that have been revised. All of those revisions have gone through the PMQI committee and approved. Additionally, we also like to link performance measures to the strategic plan and the CHIP, and also QI projects that we're doing within the department. And we want to indicate that in this document.
And that was the question I would have is based on the program guidance stuff that we did, the exercises we did in the fall, did any of the measures actually get changed for this?
I don't know, I will say in general, they are multi-directional, so you can see one of these and see that it's poor, not where you want it to be, and create a QI. Or you can do a QI and learn something from it and change the measure. Now, let me think.
Well, I know during the goal-setting meeting, we had pretty
specifically?
extensive discussions about maybe adjusting these KPIs to something much more, or some of them maybe trying to adjust them to where it was more measurable or more achievable, I think was the discussion we had during, it was that breakout session we did. I can't remember the name of it now.
Yeah, I wasn't in that.
Yeah. Because we talked about that, so if there are changes to this from those sessions from this fall, I'd love to see them highlighted while we're going through
We
this.
can go back and look at that.
You
and then
might on the
find that
strategic
answer.
plans, the ones that relate to the
Yeah, the strategic plan ones, that's what I
would
want,
be the
yeah.
The
place you
strategic
might
plan
see
has
that.
definitely informed
Cool.
any new measures
Yeah.
that have been approved this year,
Okay,
for sure.
cool.
So does that mean you only revisit these measures in the strategic plan, or are they revisited each year? For
Each year.
what you're measuring and how you're measuring it?
You know, sometimes the measure might be, people, staff indicate that they're no longer meaningful or relevant. And so when we're coming up with new measures or revising them, we'll reflect upon the strategic plan, the CHIP, and QI projects to inform new measures that are, being put into the document.
But annually, staff has an opportunity, the people who are actually doing the work, to mess with these.
Oh, yes.
Yes,
And then they all
That's the
get,
most
and
important piece.
Definitely, yeah.
and then the Performance Management QI Committee that you chair has representatives from all levels in staff and all the divisions. And so we review these before they come to you every year. We also review the revisions. So if a revision is proposed, that committee has to agree to that. It also can go the other way. We might see a measure on the committee that says, this must mean something to you, but we can't figure out what it means, and it goes through. So that happens every year. The strategic plan reviews happen actually twice a year, and they overlap, kind of like a Venn diagram, but they're not the same thing.
I think what I was uneloquently saying was if anything changed because of our comments on the strategic plan, could you call them out while we're going through this?
We'll try. I
think that's what I was going to ask for.
Yeah.
It was like, yes, if anything changed from when we looked at this last year kind of thing from there, yeah.
We have some managers here that, I wasn't at that meeting, but I think there were, because we changed goals. Yeah.
And there's a lot of opportunity for input as far as individual measures within program areas. And this year we've done I think we've improved sort of meeting one-on-one to discuss that and just to make sure that some of these larger concerns are taken into consideration. A lot of the information that exists in this document and the report, might seem kind of on the surface, just numbers, but when you look at it more closely, it allows us to do some additional things like analyze gaps and trends and differences. We can, how do we compare, if we investigate, how do we compare to local, state, or national benchmarks? In what ways is this program performing above or below our target? Are there other reasons for a sudden increase that we need to investigate? And I'll give a good example of that. One of our previous measures for infectious disease was tracking sexually transmitted infection rates. But at the same time, it was a little misleading because a lot of those rates were increasing, which doesn't look very good because we want to decrease those, but also testing was increasing and diagnosis was increasing. And so we felt that that wasn't really a great way to measure that information. So that allowed us to alter and revise that. The second is it improves results. So, you know, when we, how might our performance measure be improved? Do we need some QI tools to be put in place to kind of, you know, give a little extra oomph to working towards our target or goal? Also, what risks are we taking and what's the desired payoff? So what's the return on investment here? And then also it tells a story. So how has our program contributed to population outcomes? And that, you know, sort of the measure type tells a bit of a story as well when you look at the whole program. In what ways are our clients or stakeholders better off? New measures in infectious disease, bring that up again. Now we've changed and revised this to be the number of people tested for STIs. And this may lead to an increase in diagnosed and treated, resulting possibly in a decrease in spread of infection. And so there's a bigger picture there, and it's linked to the other steps in that line of sight. And lastly, it allows us to make decisions. So what do these numbers tell us and as far as moving forward with our program goals? Do we need to do more outreach? Do we need more staff time? Do we need more resources? So it helps us make those decisions.
And I think our mindset is to kind of bookend just some things, you know, multi-directional, like going up is good and going down is bad, and the reverse is true. And I think that the pictures try to show that.
Right.
We try to have the mindset that if something's at 0 or down there, it has to be safe to put it out there. You know, it's not like, oh, I don't want to report a bad measure, so I'm going to get rid of it. No. The mindset is if it's low, you're putting it out there so we focus on it. And to try to make that safe to do and visible. You'll also see some there we're exceeding, or maybe we're always at 100%. Why do we want to keep that on there? Well, maybe it's a mandate. And we've decided that, you know, we can't afford to fall below 100% or 90%. So.
Well, I think this chart fits really well under the strategic goals for, what did they call it, marketing? Well, what was the name of the strategic goal they had? It was effectively
Yeah.
community outreach or marketing. A lot of these numbers are super useful just kind of from a fact-based thing, or maybe even trying to work with the local newspaper or whatever to be able to constantly have a rolling report on some of these things and set up a schedule. And we could use that as outreach, because I just looked at the youth e-cig usage and then the alcohol usage, and I was like, excuse me, what? From those aspects. So that might be super interesting facts just for the community to know, which would increase that kind of interface with public health and improve the kind of community outreach marketing aspects that are in the strategic plan.
And because they are metrics, and we work really hard to get our metrics, sometimes we have to put them on there when we don't have a denominator, which is crazy. But, you know, like dog licenses, until we know what really the denominator is, we go by number. And then, you know, we'll change it as we know more. It doesn't completely resolve the whole question of to what extent are your goal statements measurable versus your objectives. I mean, that's a good argument, discussion to always find the sweet spot on. And I really appreciate that. But this one is very metric driven.
We do also, and I have one slide, it's really and some of you may have seen it before, but it's the line of sight. And when we talk about measure type, we encourage our staff to select measures you know, that are very internal and controllable, and they're output and process measures. But then also to consider that there are these intermediate or long-term measures that have you know, that are linked to population outcomes that are also important to measure. The thing is with that is, like, there are some of those short-term measures, the output and process, that are going to meet their goal a lot faster than a long-term measure. And that needs to be taken into consideration when you're looking at this document too. You know, it doesn't mean just because a long-term measure is we don't have a lot of control over it, doesn't mean we shouldn't track it. I'll give you a good example of that. Suicide prevention. We want to track suicide rates in Missoula County. Do we have a whole lot of control over that? Not necessarily, but we do have some control over some of the other measures that are on the report, which are increased number of QPR instructors, increased number of people in you know, outlying communities who are receiving QPR trainings. So those are some things that we have more control over and we can continue to work on, while also keeping our finger on some of those larger long-term outcomes. And I'm sorry I don't have, so laying some of that groundwork with some of those process and outcome measures, really, we're hoping to see that that has a connection and can impact some of the bigger issues that we face.
I'm sorry, the slide for this didn't make it.
Yeah, sorry about that, guys. And then lastly, I just wanted to say that this document, our reporting and tracking of measures is an evolving process. We continue to make strides in all areas. We're improving our total number of performance measures each year. We're also improving the performance measures that are tied to the strategic plan and CHIP, and making sure that that's in place. And then also those measures that are connected to QI. So we're seeing a continual improvement, and then also the number of new performance measures approved. So a lot of times, like I said before, there might be a measure that it's just not meaningful, it's not relevant to the work that we're doing right now. Let's think about revising this. Or program areas who have never, who are new to performance measurement and are adding new measures to this document. I had sort of a graph, but it was a snapshot of how the report continues to strive for improvement and stays relevant with the other work that we're doing at the health department. Ellen mentioned just meeting the target, and just a couple things to note. 55% of all measures this year are moving towards our target for the measure, total measure. And then 47% have met or exceeded that target. And again, to some extent, that's dependent on the type of measure that it is. Some of the next steps. Our goal is to continue to grow and improve our evolving tracking system and prevent it from being just another check-the-box thing here at the health department, but that it's just kind of a more natural process for those people working in their program areas. We do take this report after today and bring it back to the PMQI committee for further review. Also, this is the time when we talk about new quality improvement projects for the year, and how does the information presented here inform our decision on what we select for quality improvement. We also are asking managers to revisit their performance measures and review their data mid-year with their staff, so that it's not just something that I request once a year in January and it's like, oh, let me get that data, but it's something that they're kind of familiar with and tracking throughout the year. And then finally, meet with additional programs to develop new and improved measures. So those are our goals for this year. Thank you.
I'll say I really found the event you guys held that covered a lot of this stuff too earlier was it this year? I don't even know.
The quality
Yeah,
improvement
you guys' quality fair. I
QI
actually really enjoyed that kind of interaction, to be able to get some of this information, because that's kind of a boring way, no offense,
Yeah.
to receive the adventure, but the fair was much more interactive, and you had a puppy, so that helped too.
Yeah.
When was that?
We did that in
that was in
November. We did it in
Was it that
November.
long ago? Man.
You didn't miss it because you weren't here yet, but yeah, that was really cool.
So does this end up affecting the work plans of people within these specific programs? They look at this, and think, oh, we really need to bump this one up.
It does, yeah.
I have a couple questions. So under Let's Move.
What page are you on? Does it have
I don't know.
Doesn't have a page? Okay, let's move.
Let's move.
It's like the fourth page, I
Probably
think.
couldn't fit the page.
It's the
number
fourth
there.
sheet of paper.
Thank you.
It's green.
So,
At the top.
number 2, increased number of teachers receiving physical activity training. Is that something we're putting a lot of time and energy towards?
Well, does someone else want to speak to that? Sure.
Yeah, go ahead.
Cindy.
Do I need to come up there?
Yeah, you do.
Oh,
Sorry.
I knew.
We did a Tom Sawyer on that where we did it, and it looked like a whole lot of fun to
So-
paint that
oh,
fence, so
okay.
the teachers are doing it.
So we're not putting a ton of time and energy into it. It's one of those things that what we know is that if kids have more physical activity during the day, during the classroom time, whether that is like brain breaks or taking a 10-minute break in between classes, then kids perform better in school, and it also reduces the rates of obesity, and we're actually seeing that decreased obesity rates.
So I understand that with kids, it says increased number of teachers receiving physical.
So, because we want the teachers to be doing the physical activity with the kids in the classroom.
Might make that a little more clear.
Yeah.
Okay, yeah.
That's what that is. So I'm like, I don't think we need to be telling adults how to. And then I had another question on the next page, so it's the back side of that. Are we also tracking suicide attempts, not just completed suicides? Because that seems like that'd be something really important too.
The thing with trying to track that is that it would be coded at the hospital, and it depends on what the CPT code is for under admissions, and so it's really hard to get that data, because one doctor might code it as a suicide attempt, and one doctor might code it as an accidental injury or an intentional injury,
overdose.
or there's too many ways that they can code it at the hospital.
I would try to come up with some sort of algorithm or some sort of parameters to track that, because I think that's probably, I don't mean to say it's more important than completed suicides, but it really is. Because if we're trying to get ahead of it, we have to know what people are doing, why they're doing it, and the frequency, right?
Yeah,
So I would think I hate to say it, out of all of this stuff, that might be one of the most important things we
I'll
need to
chat
be
with
tracking.
Nancy, and she'll actually be here later on in the meeting, but we could definitely work with the hospitals on that. Another avenue that we might be able to try is working with the state health department, because they can sometimes get us different data than what we're able to get just working directly with the hospital. So I can definitely look into that.
And I know Carl Roston at the state, who's the suicide prevention coordinator for the state of Montana, he has also indicated that tracking that data is very difficult to do. Doesn't mean it shouldn't happen.
Here, but I mean, don't you think it's probably a component we're really missing?
I mean, I think it would be useful data to have. I would echo what these folks are telling you, is pulling that out of medical documentation, and especially most of what we're pulling out is, claims level data that just has a diagnosis code is difficult, because there isn't one diagnosis code. That there's just going to be a lot of mess in trying to identify that data with what we have.
And there might be different code issues, because I know attempted suicide has different coverage or whatever if someone does complete it for life insurance versus if it was an accidental event. So, sometimes they don't pay out, so people might be apprehensive to put that as a code or whatever during admission.
It's still really worth a question.
How many words are you allowed to put on an EHR when they go in, like actual words when you're coding? Are you only allowed to put in codes, or are you allowed to put, are diagnostic notes allowed? Because it may be a way to extrapolate certain words, right? Build an algorithm on how many words are appearing within, and whether or not that's a predictor of.
I think that Dr. Holtzman up at the state medical officer might be able to pull some syndromic surveillance data in that way. They've got access to different data than what we can get working directly with the hospitals, so that is a possibility. I can definitely talk to him. We're actually trying to do that to get more syndromic surveillance data on opioid overdoses too, using that same kind of thought process. So.
Something else we could lead on, right?
And I apologize that we weren't able to get Christie's PowerPoint up. We've had a lot of technical issues trying to get set up in here today. I'd be happy to send it to you.
Are you willing to pass that chart around real quick? Your thing that we didn't get? Just pass me look at it real quick.
And then the only other question I have is whether or not we're tracking STIs in seniors.
We are tracking, we track all STIs through a database that is like a web-based platform with the state, and so we can extrapolate that data. We would just have to pull it out of the database. So, we haven't
that's on the rise too.
We haven't seen a huge increase in STIs in seniors, but we are seeing a lot more co-infection with chlamydia and gonorrhea, but that is probably because we were having a really hard time getting doctors to test for gonorrhea for a long time, and so we knew it because all of the counties around us had high gonorrhea rates, and we had none. So we had to do a lot of outreach.
Be careful what you wish for.
Yeah.
It was that force field. They would come, right?
I have just two super quick comments. One is thank you. It is way harder to be a data-driven organization and way easier to just like not do work like this. So thank you to all the people that are doing the work. And one other just sort of editorial comment. I know that the people in each department know exactly where this data is coming from. There were several places looking through, you know, especially with some of the clinical services where I had to kind of adjust my lens and say, is this health department clients or is this a community measure? And, you know, I mean, like just looking at the infectious disease, to somebody outside looking at this, it's really not apparent. The number of people tested for HIV, is that, you know, our health department clinic, is that in Missoula County? And there's mixing of both in here, so
That's good
just to try and make that a little bit clearer, you know, without like putting detailed
That's
numerator
good.
and denominator throughout the whole report of
And that is.
what population we're talking about for each measure.
Yeah, and that is the internal, how many people we're testing through our
Yeah,
HIV.
and I like,
so.
you can kind of figure it out with
Right.
some knowledge, and I know the people that are living this every day know, but
Oh, we can start to
for,
make it more
for
clear.
external
It takes like
consumption, that might be
external eyes
helpful.
to actually see that, for sure.
Yeah.
And just too, we have all of this information plus so much more archived in a, you know, Excel spreadsheet that has source data, you know, date when the measure, the staff met to actually come up with the measures, the reasons for selecting the measure, all of that is tracked and kept somewhere. It's just not in this report. This is a snapshot of it.
I'm a new person, so the thing that's in my head you may already be doing, but this is such great information. I wonder if it would be possible to pull out what you feel like are highlights, are the most meaningful and interesting, with a really easy to digest narrative for a person who isn't in the public health world, and then put that in the newspaper or make it
Right.
readily available,
And-
because this stuff is interesting to
and that
anyone who lives in
is-
Missoula.
And we're working on that because what we really want to inspire staff to do is to actually use this to tell the story. You know what I'm saying? And like say,
There's opaques, there's stories hidden behind every
Definite-
one of these
exactly,
hard to digest
exactly.
graphs unless you're a public health professional.
I have an even more pointed comment on that. How is our revenue sources, AKA the funding sources for the Department of Health, how are they receiving this information, or are they even receiving this information?
Some of it, but I would say probably not most of it.
So how do we deliver this in a way very much like the event you guys hosted, where it's easy to digest and it demonstrates the importance of all this work? That would be the question I would ask back to staff and leadership and whatever, is how do we get this in front of the, lack of a better term, revenue sources for the Department of Health, so they can understand the value that not only what the Department of Health does, but what this information is providing to the community.
That's a really good point, because we generally do it topic by topic, like, no, don't cut this.
Grant by grant, yeah.
Yeah, and then it would be kind of interesting because so much of it is done without their funding.
Yeah.
Yeah,
That'd be
it's
good to-
local,
Marketing.
local support.
Marketing, it might be good to have an event like you were talking about, where just the highlights and the really
I
interesting
didn't just,
stuff.
they did it, it was good, I liked it, that's why I'm like.
Maybe we
Thank you.
invite the public,
Yeah.
like we're doing next week with the, what's the name it just ran out, the Academy, anybody involved in that?
Oh, that's
The
right.
local
Is
government
that this
academy.
week? That's next week.
Oh,
That's
yeah,
a week from
Heather's.
Yeah, that'll be
Tuesday.
there, okay.
Yeah, but it could see something like that with the health
Oh, no.
department, where you
Yeah, I could be in
move
Helena.
people through some of these spaces, had some of your amazing department heads talk about what they do and highlight some of this stuff. And this is great for public health professionals, but unless you're that, this is like diving into sand. Like, this is
Yeah.
not, you're not gonna do it.
That might be a good topic to put on our next PMQI agenda.
Yeah, how to get it out there.
Discuss it.
This is
And
great,
I
it's great
want to
work.
keep it safe for where, I want to keep that balance between, yeah, we want the public to know, but we want the people responsible for the work to feel safe. If you're dealing with just a number that just, no matter what you do, it just kind of doesn't go up there, so we'll have to talk about how to do
The
it.
best lesson I've learned that people seem to like lately is document, don't create. So this work's already been done, we just need to document it in a way that's easy to consume for people. Whether that's delivering it in an event, or it's in a one-page briefing that pulls out the highlights of why how the health department's so important, yada, yada, yada.
Well, one way we might think about doing that is kind of how we did it with the community health assessment, where Robin pulled together just a couple of pages of here's the big highlights that came out of our community health assessment. But
Just to do highlights from the report each year.
And and I wouldn't be shy about the ones that didn't move, because it's not because
Right.
you don't have dedicated people working hard who know what they're doing. It's because of these larger systemic social issues, and those are worth highlighting. So if somebody says, like, how come XYZ didn't happen, that person must be not doing their job. No, it's actually, it's an opportunity for education.
Thanks for that comment. We'll call you when we get that.
Tell me what to say, I'll say it.
I move that we accept the performance management report.
Can we just talk in circles for 1 minute?
Unfortunately, we have a lot more to do.
All right, so we've got a motion on the floor. Any public comment on the motion? Seeing none, any further board or staff comments on the motion? Seeing none, all in favor, say aye.
Aye.
All right, so moved. Great. So we will then move on to item number 4, which is amend and re-adopt the quarantine and isolation policy, and Cindy's going to walk us through that.
All right, so last year, for those of you who are not new, we looked at and re-looked at the quarantine and isolation policy to determine what needed to be changed and updated. And Anna astutely caught a typo in the MCA on page, what page was that? 2. So it said in the second bullet under local health board and local health officer, administrative rules of Montana, title, it said title 20 and it should be title, or 27, it should be title 37. And it said chapter 14 and it should have been chapter 114. So that's the only thing that we need to change. But we were just thinking about the measles outbreak that's happening in Washington right now, which is just continuing to grow. The latest numbers are 64 cases in Washington. Huh?
I think mine says 67 this morning.
Oh, yeah. So, well, there's 64 in Washington and 4 in Oregon.
Okay.
Yeah. So, and of those, most of them are either unverified, whether or not they were immunized, or not immunized at all. I believe 55 cases of those were definitely not immunized. And there were like 6 that they couldn't verify immunizations for, and a few that were only received 1 MMR instead of the 2 that it takes to actually build immunity. So with that in mind, we were pulling out the quarantine and isolation policy because we expect that it's probably only a matter of time before we have our first case here. So.
And I would just like to add, there are a few other types of corrections that are mostly just formatting related, because we changed the department's policy on policies last April. And so the look and so forth has to be tweaked just a little bit. And in the copies that we sent to you, it actually doesn't have the department's logo, and I did add the logo in, so the copy that Ross will sign complies with the policy on policies.
It's only because of accreditation that we have to have a policy on policies. I just want you to know I wouldn't have made that up.
Yeah, and just so you guys know, we are having internal meetings once a week to make sure that we're prepared for measles, and we've already been reaching out with our community partners to ensure that they are notifying us if they have any suspected cases. In fact, I got a call this morning that was a suspected, turned out not to be, knock on wood. So, so yeah, we are definitely amping up our preparedness for our first case.
I'd move to amend and re-adopt the quarantine and isolation policy.
All right, so we've got a motion on the floor. Any public comment on the motion? Seeing none, any board or staff comments or discussion on the motion? Seeing none, all in favor say aye.
Aye.
So moved. All right, thanks, Cindy.
Strategic plan.
So that's it.
Is that next?
Mm-hmm.
No, okay.
One to sign.
Stay put.
All right.
All right, next we move on to a non-action item, which is a strategic plan mid-year report.
This is the time of year that we give you we're working on it, we finished it, we didn't start it yet report. This is not your narrative, that comes at the end of the year. We give a progress report every year. This is just, have you gotten started or not? So that's a quick one. So just paying attention to the highlighted sections to the right. Julie's trying to drive it.
I think you're going the wrong way.
Yeah.
Ooh, that is so hard to do.
You want me to try?
Maybe you can see better than I can. I can't see my glasses on.
I don't know if I can get it there either. There it goes, okay.
So you'll see when you're going through this report that there are several of these objectives that have where the actions have already actually been met. And that doesn't mean that people are going to quit working on that. It just means that they've met their goal or they've done that particular step.
And you'll see some that weren't started, and some of those are in my area. And I do commit to starting them when the legislature goes home.
My only questions are in community relations and branding. Seems a little slim, guys.
Yeah, I haven't started the department planning process. All I did was my class. So I simply have not been able to pull that together.
I'm sure you have lots of ideas.
Well, I could use some more ideas and a few less excuses, but we will be sending in our 5-year reaccreditation in about 2 weeks, and then that will also open up some room for the management team to start planning.
And one big thing that is actually not on this report in that area is our HIV van is done getting upfitted and it's about to get wrapped. And the wrap that's going to go on it is really just going to be all about public health. And we've already got, I've been meeting with the different managers and division directors about different ways that we can use that van to actually do a lot of outreach. And it says Missoula City County Health Department all over it. So that'll go a long way towards branding.
If there's one thing you want the community to know about anything about public health, what is it?
That's a good question.
Oh, boy.
You get one.
One thing.
And you give me an official statement and I'll push it to everybody I know.
Yeah, ignore it at your peril. I don't know.
Well, that you're a partner, you're not the police. I mean, that's
a good one.
That is a good one.
We're here for you. We're here for you.
We're here for you.
Yeah.
I have a lot of them. I can't pick one.
You're gonna
She
have
needs to
to,
get accredited first.
but that'd be the one thing I'd
You're
be like,
accredited isn't very inspiring.
But it's true. I mean, if there was just one, you all and we all can be talking about it in just that same term. I think everybody that's out there is just
I think
using
that would
this
be a really
in
great
terms of trying
exercise
to-
when we do convene.
Yeah.
I'll mention it on everything I'm on. I mean, be careful what you wish for and make sure it's what you want said.
Yeah, that would take some thought.
I always relate it to the immune system, and I don't think that works for all audiences, so.
Well, honestly, you want any brainstorming or anything, just let me know. I'll totally come in and I meet with marketing people like 3 or 4 times
Yeah.
a day all over the nation now.
Yeah.
So like anything you want to talk about, I can be like, this worked, this didn't work, list this, how's your Instagram page doing, whatever. We can talk about
So
whatever.
you offered that. Julie, of course, has that background, has made offers, and then the gentleman who taught the class that I was in also has an open offer. So we will definitely be reaching out, get those ideas.
But you are going to use a consultant to facilitate the process.
Yes.
To getting.
I haven't even come up with a budget yet for that, because I think I need to have the informal yak before I try to budget that.
After the legislature's over, Ann in our office would be a great resource too. I'm sure she'd be.
Yeah,
to help
she
you.
is. Yeah.
She's up to her eyeballs in legislation.
She is too, I know, but she thinks of those things all along the
Oh,
way.
yeah.
Do you guys have an internship program with the,
We have a lot of interns and different types of student relationships. We don't have one in that arena.
I was like,
though,
can we
so I
pull
think
some J-school students in?
That would be a neat arena to bring someone in.
If nothing else,
Or
they
the
could run your
business
social media
school.
accounts or something.
Business
Business
school
school or the
and-
journalism school or whatever,
Yeah.
so.
And I have actually had interns from the communications department. It's been a couple of years now, so.
Yeah, because then they could maybe even do it for credit, so you guys could get benefit from them and they could get benefit from school. So.
Yeah, give it about a month and I think we'll be going.
All right.
Any other
Right.
questions?
Thanks, Ellen. So then we move on to item number 6, which is monthly updates on the strategic priorities. And I guess we're going to start out with health goal 3. And Colleen's going to walk us through that.
Hello. So I'm Colleen Morris, and I manage the immunization clinic here at the health department. And I am going to give our update. It's going to be pretty quick. It's relatively brief on goal 3 under community health, the first strategic priority. So really what we made for goal 3 as part of this strategic plan is to conduct targeted outreach, marketing, and other methods to improve participation and outcomes in 2 health services division services by June 30th of 2021. And those 2 health services divisions are WIC and nutrition as one, and then the clinic services as the other. And so I'm just giving an update on my part, which is Objective 2, and Kate Deveneaux will come back at another meeting and give an update on her first objective under Goal 3. So on the left there you can see our Goal 3 Objective 2 is to increase the number of 15-year-olds who have received at least 1 dose of the following teen vaccines by the end of fiscal year 2020. And so those 3 teen vaccines are meningococcal, Tdap, and HPV. And we use data from our AFIX visit, which is when the state comes every other year. They came in August and they look at our clinic data. So specific to, this is data not Missoula-wide, this is just Missoula City County Health Department, the people that we see in our clinic. And so our vaccine coverage rates with the goal to increase those. So each one, I couldn't just say by 5% or anything because they all vary a little bit. So for meningitis rates, it looks like we're at 45% of teens that we see who are 15 have gotten 1 dose, and I'd like to get that up to 50. For Tdap, we're a little higher because it's a required vaccine for school. So 63% have gotten 1 dose by then. We want that to go up to 70.
Is that the same as DTaP? Is that the same?
DTaP is a child version, and Tdap is the adolescent adult.
Okay.
So just a bigger
What does that stand for?
dose. Tetanus, diphtheria, and pertussis. Yeah. So it covers whooping cough. And that became a required vaccine a number of years ago in school.
Yeah, about 5 years ago.
Yeah, 5 years ago, to really decrease whooping cough rates that we were seeing outbreaks in communities. So, and then HPV to prevent cervical cancer and other kinds of cancer in kiddos, and that is 42%, and we want that to go up to 47%.
Is there a plan to make HPV less controversial? The vaccine for that? Is there any kind of thought?
If you noticed how I presented it, that's kind of the plan, is to really market it as a cancer prevention vaccine and not an STD-related vaccine. So yes, there is big movements underway right now. The state itself has a HPV working group, and so we are part of that working group, and so they're really focused, you know, on the whole state, trying to figure out how can we communicate better as providers about it, to make parents and kids more interested in it and less afraid of it, or, you know, it not to have that stigma about, well, my kid's not sexually active, why do you want them to get it? Because really we recommend this at 11 to 12 as the first dose. And so, you know, the idea of you can prevent cancer in your child when they do, you want to, this is all about prevention. You don't want to do it when they're already they've already had sex, you know, with somebody, it's kind of almost too late. So, potentially. So we want to catch everybody early and just trying to have more messages, though it's about preventing cancer. And we actually just, I met with a lady who's a new faculty member at U of M a couple days ago, and she's doing a research project on how to, you know, just vaccine hesitancy in general, but really around HPV and trying to raise the rates. Because it's one that in Montana, in the US in general, really lags behind some other countries. And when it's the real first, I mean, if you maybe second to hepatitis B, cancer prevention vaccine, why is the rate so low of uptake, you know? So
I'm impressed it's 42%. I would have guessed way lower than that.
yeah, so that's an average between girls and boys, and
Okay.
it is much lower for boys. So the girls kind of, because it was first recommended for females only, and so we're still trying to get the boys and the parents of the boys to understand that it can be beneficial to them as well.
And I know there's correlation between HPV and other cancers. Is there correlation between the vaccine and preventing other cancers, like mouth and throat cancers?
You know, so we just had a talk where from the pharmaceutical reps who market HPV, and they really clarified that there's anecdotal evidence that shows that oral pharyngeal cancer may be decreased, but the way that it was licensed with the FDA did not show that, so they can't say that it does.
Okay.
Yeah, but if
I was just
you
thinking
talk
that might
to-
actually help in kind of uptake
Right.
if you say, you know,
I
if you do
know,
oral
so we can
pharyngeal
say
cancers
that,
too.
you know, if we want to, because we're not the pharmaceutical rep people, but if we really, you know, dove down into the evidence, I mean, we could find some, there is, but it wasn't enough for the marketing, or when it was marketed and licensed, I guess,
It
wasn't.
might help for our objective increase rate for your goals, to be able to find that clinical information that proves that and be able to say that.
Sure, I mean, it's definitely cervical, vaginal, anal, penile cancers, but if we can move towards throat and oral, you know, the couple of HPV events that I've gone to where we brought in a screening of Someone You Love, which is this really powerful documentary, and we partnered with the American Cancer Society, and so they're taking a big role in also trying to get this out, you know, let's get HPV rates up because they know it makes a difference. And some of the speakers that were on the panel that we sat on, one was a gentleman who had oropharyngeal cancer, and he's a survivor, and then one was a radiologist in town who also spoke at another talk, I think, and she, I mean, just is seeing lots of oral cancers that she believes or can, you know, show is related to this, to HPV virus, and we know this prevents the cancer, and so there's that link.
That might really help with kind of combating the stigma around it.
Right, so we're really getting, the American Cancer Society is helping, I think, get rid of some of this stigma, and so us partnering with them, and so we'll continue working with this gal from the university to, you know, provide her feedback, and she'll do an interview with our clinic nurses here just to see what's their experience recommending HPV to parents, so that we can maybe come up with some sort of, I don't know if it's a community-wide outreach with the ACS, I don't know, there's all kinds of ideas out there, but it definitely is a big focus because it's a very effective vaccine and very safe.
One of the big barriers too is that teenagers just don't show up for regular health care.
Right.
You know,
They don't want shots,
they'll
and-
do the walk-in sports visit at the high school so they can play basketball, and that's their health care, but they don't get vaccinated.
That's
at
where
that
we
visit.
should get it.
Right, which is what actually some communities
I
have
think
done.
in clinical practice, you know, in the last 10 years since we've been now vaccinating people, the resistance is a minority compared to the people that just missed opportunities because they don't show up for care.
Yeah.
Like, so I you know, I get way less parental and family pushback about any of the teenage vaccines, including HPV, than I did, you know, 5 years ago in practice.
Yeah, and I think we found as a clinic as a whole is that if we recommend all three of them together as like, you know, that provider recommendation of here's what your child should get today, your teen should get these three things, and we say it with confidence and that we believe in it and they're super important, most parents are like, okay, cool. But if we don't say it, or we're hesitant, or, you know, anything like that, they just really feed off of that. And so coming across as very, you know, like this is what you need to get today. And we really see a difference in that. So anyways, I don't know. I didn't know I could talk so much. So, so our first step is to identify and implement a child and adolescent reminder recall system so that we can get those kiddos back who maybe missed their second dose of HPV or their second meningitis, or were due for Tdap and haven't gotten it yet. Which is less of an issue because of the school requirement again. So by the end of January, that was my goal, is to find this program. So we did identify a system that we want to use. Unfortunately, the EHR that we went to, which we thought could do a recall system, it couldn't, and so we've had to find an outside system. This is through one of the pharmaceutical companies, and it's free. So it's called Vaccine Adherence for Kids. We just got the contract to go through, you know, everyone signed the contract. We're ready to go. I had a phone call with the company yesterday, and we will start doing the child reminder recall program, hoping by the end of March. Everything takes longer than you think it needs to with the transition of the state registry right now to a new platform. We need to make sure that gets the kinks out of it before we start trying to pull data from it and we'll be sending out postcards and phone calls to families who come to our clinic. And it will be marketed as coming from Missoula City County Health Department with our logo on the postcards. And again, they're welcome to go to whatever provider they want. We just really want them to know that they're due for a vaccine. So the adolescent program will follow. And we're going to kind of test out the child one right now, so for 6 months to 16 months, and then we'll move to adolescence, but sometime in the spring, I'm hoping. So that's kind of where we're at with that. I just put up here our other 2 steps that we're taking to meet this objective, is to meet quarterly with the community partners in the form of a Missoula Immunization Coalition, and that I have a goal of by June. And we actually have a meeting scheduled in March, and that will be our 3rd coalition meeting. We just started last May meeting, and we met again in December, and so our next one will be March. And that, again, I think we're working with the schools and just other key stakeholders in the community to really, overall goal of raise vaccine rates. And the 3rd thing is to develop an incentive program for adolescents who received 1 or more teen vaccines at 2 designated time periods throughout the year. This one's kind of a work in progress. We have some ideas, and again, partnering with the schools and maybe doing partnering with a clinic or something for sports physicals. But on-site school, something is kind of what I'm picturing, maybe starting with Willard School. Just the talks are underway. So we'll see what we can do. And we have some money from the state to provide maybe gift cards or something to kids who come, or do a drawing or something like that. So
what if you work with like a local business that kind of supports health goals too, like let's say Flying Squirrel as an example, and they give a discount, like a 10% off coupon or whatever for someone who does that.
Ooh, that's a good idea.
What are they called?
Flying Squirrel, it's the trampoline one. I was thinking physical activity plus like incentive. I don't know, I'm just trying to tie things together.
Or freestyle.
Yeah, the climbing. Yeah, that's a good idea. So
I usually would say food, but that's kind of counterintuitive,
yeah, no,
right?
we don't need to
Our
do
goals.
the right kind of food. Yeah. So yes, that's what we're just going to work on, brainstorming those kind of ideas. So yep, that'll be good.
All right.
Let's see what we come up with. Okay.
All right, thanks, Colleen.
Thank you.
All right. Now we're going to get an update on Goal 5 with Lisa.
Good morning.
Hi.
Good afternoon.
Yeah.
We made it to the other side.
Yay, it worked. All right, my name is Lisa Piskevich. I'm the Health Promotion Prevention Supervisor, and as well as Invest Health Team Leader. And for those of you that aren't familiar, Invest Health was a grant we received in 2016 from the Robert Wood Johnson Foundation Reinvestment Fund to really look at our low socioeconomic groups in the neighborhoods of Franklin to Fort, North Side, West Side, and River Road, because we discovered that they had poor health outcomes through a beautiful tool called Policy Map, which really pulls in all the centralized database with the national health ranking outcomes from BRFIS, Behavioral Risk Factor Surveillance System, American Community Survey, all these major data sources all compressed into one. And what's beautiful about it is the GIS tool of it is that you can go into it and you can draw neighborhood boundaries. And so really getting at that census tract block level data to know how neighborhoods are doing and how people are doing within those neighborhoods. So that's the impetus of all of this work, and it really brought in, as you can see at the bottom there, community health with community development. So a requirement of the grant was to have a representation from community development, community health, a 5-member team with an anchor institution, which is Providence St. Pat's, to do the work, to start having the conversation about built environment and health outcomes and social determinants of health and how they're all connected. So I feel like we have learned so much in the past few years about our community. It's been really great. So this is the first year we put Invest Health on the strategic plan because the grant ran out, but there's still reaching out to the cities. There was 50 cities awarded this grant, mid-sized cities. We are a small mid-sized city, just so you know, at our level of, well, it was 60,000, 70,000 people. And then we have larger cities like Spokane, mid-sized cities. So there was 50 chosen nationwide, so I feel very honored that we were one of those cities chosen. So we participated in networking with other cities and going to their communities, Iowa City and Eau Claire, Wisconsin, and taking tours of their towns and talking about similar challenges with engaging people in healthy behaviors and looking at housing crises or just a nationwide problem that people are, cities and counties are grappling around. And so anyway, so here's our story. Oh, where am I going, Julie?
Try one of the
arrow?
Yeah, that should do it.
Perfect. Okay, so I'm going to talk about Goal 5, that create a system to engage community residents of the Invest Health neighborhoods to inform health department programs and Invest Health by the end of fiscal year 2021. And I can share also too, another big piece of this work is going back to the residents and saying, hey, how are you doing and what do you need? Because how many times do we say, oh, I think this person needs to have a grocery store in their neighborhood, or they need a sidewalk there, or they need a light there. Like, we can think these great ideas because this is how we think, but to really make sure that we're doing our investments properly, taking it to the people that need it the most and that are asking for it. So this is what do they call them? A word cloud. These were words that were used in the neighborhood survey that I partnered with the university to do this past, I don't know why I keep going to that, fall. So objective 1, we conducted, this is building on a survey that we did with the original grant, where we mailed home surveys, like 40 question surveys, trying to better understand what the residents needed to access health and wellness and make healthy choice an easy choice. But we felt like we missed some of our low-income people, and so we wanted to go back and do a door knocking, what I called the Montana Health Canvassing Project, and just kept looking at Forward Montana and said, how do they do that? And so we developed a script and interview questions with the input from our Missoula Invest Health Steering Committee, which the steering committee was on that first page. United Way, Susan Hay Patrick, LaBelle Means, City Missoula Development Planning Services, Kaya Peterson from NeighborWorks Montana, and then we have Karen Myers from Providence St. Pat's and myself. And we looked at the neighborhood report to develop these questions. And we really wanted to build on that report. People said that they wanted community centers or third places, someplace to go. We know a lot about how people access health is not just their physical health, but it's their social health too, and their emotional health. So we heard that loud and clear in our surveys before, and also going to the neighborhood councils and visiting with people in their neighborhoods about what that looked like. Stress kept coming up on all the reports. It was like, oh my goodness, what are people stressed about? Stress is such a vague world. Stress for each one of us can look differently. So I wanted to know more about what stress meant to them and what the neighborhood environment, when they woke up in the morning, what choices were they making in their neighborhood about where they live, work, and play, go to school. And so we wanted to keep the questions simple and to the point, really thinking about that health literacy language. And then we wanted to develop a script to actually have a conversation with a person at a door and just not like check the box and say, see you, bye, you know. And to really get them to think about how they, it's my default, huh?
I know.
I'm on the computer way too much. How they access their health, mood, and relationships. I love the word mood, by the way.
Yeah.
What is your mood today? Yeah.
This moment.
Yeah. So then I partnered with Annie Sondag, which she is a professor at the University of Montana and the Community Health Department, which is now part of the University of Montana Health and Medicine world. You know, the university shifted a little bit, and so they're all under that part of the sector of the school now. So working with her and a group of grad students in the community health class. And so worked with them and went to their class pretty much weekly from September till the end of the semester and worked with these students and reached out to Ford, Montana and said, hey, will you come train us on how to do this door knocking canvassing? Because we want to be safe, we want to do this right. We want this to be really relational. That was a big goal of the work. And so I just threw this script up here because this was on our actual questionnaire forms, and that we trained ourselves and we practiced, you know, modeling that behavior so everybody felt really comfortable in engaging with people. Nobody had ever done this work before, so that was kind of cool. So once again, it was a really great relationship. Students were learning and we were learning with the health department. And then we put observations, like we didn't want it to be like, oh, do you live in a trailer home or a single family home? So we just wrote down what we saw to make it shorter. And then, so our goal was 60, to do 60 interviews by the end of this fiscal year. And then compile a summary report. And I put in your packets a copy of a brief summary report that I hope you had a chance to look at and review. And this is the highlights of what we learned. We went to the West Side, the highest poverty, poorest health outcomes neighborhood. We dove in with Policy Map and picked the blocks that were the poorest. So I don't know if any of you are familiar with the West Side, but we went to Hollywood Court, which is a heavily trailer parked neighborhood. We also went to some single family homes and started knocking on doors. And we knocked on 146 doors. We had 3 teams of 2 students. 40 residents participated. I would tell you, overwhelmingly, people wanted to talk. We guesstimated 5 minutes per door. 20 minutes per door was the average. Wow. Yeah, amazing, huh?
You should try campaigning.
Yeah. Well, I just
Same situation.
It was just shocking to me. I had no idea. So then the students with Annie and I's assistance put together this summary report to share with you all, as well as I want to share that we also have shared this with the mayor and with Chief Brady and Ethan Smith, because as you can
I see crime pop up a lot.
Right.
It's an interesting neighborhood.
Right.
Hollywood Trailer Park, that's the first
What?
thing. You said the Hollywood Trailer Park, that's the first thing.
Yeah, so we felt that it was very thoughtful before we took this back to the Missoula Invest Health Steering Committee table of community members that want to do good work and help move this forward and build these neighborhoods up to be safe and healthy. We wanted to go to the mayor first to share this information so that they were aware of what we were learning. As you can imagine, they weren't surprised at what we learned, right? The health and safety of the neighborhood. But I would also say the health and safety of the home and the landlord property housing management issues were huge. That people were afraid to report noise or no running water or a moldy bathroom or a leaky roof because they didn't want to be evicted. Their fear of eviction was huge. So I'm going to live in these unhealthy conditions because it's safer, because I have a roof over my head. And that was an overwhelming thing that was shocking and surprising. I just didn't know that world.
Did people talk at all about who they rented from? I'm not asking about individual names, but if they were
we can find out
associated with
that.
Property management companies,
Yeah.
because maybe there might be a few.
Right, and that's why we took the information to the mayor and his team of people and said, this is what we learned, so how can we help support the effort to help these people to live in better environments?
You can see this is just one more of the negative consequences of our high real estate growth. If you're a property management company, you would know if there's a problem tenant, you could get them out and there'd be someone to take their spot right away.
Exactly.
Little incentive.
Yeah,
for
they're holding on
attention.
really tight to what they have and they're not gonna let it go. And what might seem like unhealthy conditions to us is still a roof over their heads, you know, so, okay. And so then we continue to work with our Invest Health team members to look at these neighborhood surveys and to look at small, medium, and large infrastructure project strategies to help foster and build the community neighborhood connections and programs. So we created a project criteria guide looking at the whys and the hows, like being very data driven, having community resident engagement, having health equity, and really looking at policies, plans, and systems and being collaborative, aligning and leveraging the resources we have in our community to make them better. Continuing to update our community health map on about what this looks like in our community with the constant development that's happening, which I would tell you our maps are changing quickly as far as our land use goes. And then this is where we set up the meeting with the mayor. I just quickly threw this up here. This is our project criteria that our team came up with. So if anybody comes to the Invest Health table, this is the lens that we will take that project through and write that grant or proposal. And I've actually added one this past week. After the how, it would be the action. What are you motivated to work on? And what are you going to do? So kind of like, okay, this is very interesting, but what are you really ready to put your effort and energy around? So,
is there plans to do this with other neighborhoods?
Not right now, we don't have the resources. So, but the thing is if we can do this work in these 3 neighborhoods, we can pretty much do it anywhere.
That's great. Okay.
Right? So, now to identify and request, prioritize, and look for upstream health investments to invest in these neighborhoods. We did submit to Providence St. Pat's a Housing as Health proposal, and they're investing $40,000 right now that we're partnering with NeighborWorks and the Human Resource Council and PHC to develop a two-pronged approach, a system to look at how we're going to refer somebody with a poor health outcome in these neighborhoods, usually a Medicaid person, with a home rehab project if we know that the moldy bathroom and this person has asthma is making them sick, and to fix the problem. So we're piloting that now, and we'll be back to report on how that's going. And then next month we have a proposal to put into the Robert Wood Johnson Reinvestment Fund on an Invest Health Building Grant proposal that the team will be working on. And then also a community resident engagement broad-based organization work with actually the Interfaith Collaborative, as well as creating a health equity coordinator position here at the health department to really help empower our residents, as well as looking at our internal systems through the lens of health equity.
I want to really point out that this is all being done with passion and continuing work relationships. There's no dedicated funding right now. So the third bullet down there, I mean, Lisa is a manager of several other programs.
Yeah.
The third bullet down there would extend her reach so that we really could have dedicated focus from the department.
So that'd be another person?
Correct, full-time.
If we can get it.
For next year.
For as long as we could get it, if we can get it.
It'd be in the budget for next year.
If we can get
Correct.
it.
We're presenting next month to a foundation.
To a foundation. That's-
Headwaters.
Oh, that's just what they should be doing.
That's what I think.
They're very interested. And this will all drive then a strategic plan in the future for Missoula Invest Health. And so I put up here our mission and vision. Missoula Invest Health initiatives improve community health through the collaboration of partner organizations to work with community residents, students, and professors in neighborhoods facing the biggest barriers to health. Vision, all community residents have equal access to opportunities and enable them to lead healthy lives. And so now we have a steering committee with currently 31 individuals that represent a large, diverse sector of our community, from Native Americans, seniors, people with disabilities, business, faith-based government, healthcare, the U of M, and Missoula's vibrant nonprofit network. So we're all looking to engage community residents. And the big words are align and leverage, right? Right. So,
Wow.
yeah.
You said you presented this to the mayor and key staff, was it the city council as well?
Not just
The survey outcome.
the survey outcomes. I haven't presented this to city council, not yet.
All right,
So that's it in a nutshell. Thanks for your time.
thank you. Now we move on to presentation on goal 4 with Leah.
It's kind of health promotion day here, isn't it?
Really is.
Or as we like to call it,
Like
health.
half of my health promotions.
Yeah. Health devotion. Health devotion.
Well, this is the most interesting KPI in the document I flipped through real quick, is the incidence rate on this. I was like,
Really?
oh, really?
Your flash drive.
Okay, okay.
Leah came over to the health department from the Missoula Forum a year ago.
Yes.
Which is now going to be called the Substance Abuse Prevention Program because it tells us what they're doing.
As opposed to what is the forum and what is a forum? Yeah.
Sort of a Roman notion.
Let's see. Sorry. Trying to find.
Cindy, can you read that for us to help us find it?
There we go.
Sorry.
I got it. Oh yeah, that's it. All right. So yes, I am in the health promotions division of the health department, and I am a substance abuse prevention coordinator. And again, like Ellen was saying, we recently changed from the Forum for Children and Youth to the Substance Abuse Prevention Program. And the forum was actually under the Grants and Community Programs, which dissolved a couple of years ago, and so moved over to the health department. And so quite a few things have changed, but there are some things that we've stayed pretty consistent with, and that is underage substance abuse. What we do know about substance use in Missoula is recently Missoula was named the 13th drunk, I don't like this term, but the 13th drunkest city in the nation according to county health rankings and roadmaps. That means about 23.8% of adults report that they regularly drink heavily or binge drink, and almost half of all driving deaths are alcohol related. We also do have a DUI task force in the health department as well that are addressing that. But we know that preventing substance abuse starts with working with kids and parents and trying to prevent substance use from happening. If we can prevent a child from drinking before the age of 16, they are 2 times less likely to have a drinking problem and 4 times less likely to have a drug problem. So really important to prevent. So again, we're doing goal 4, substance abuse prevention, reduce Missoula County youth 8th, 10th, and 12th graders self-reported 30-day use of alcohol by 10% by the end of fiscal year 2021 from a baseline of 28% reported in 2016. This is from the Montana Prevention Needs Assessment that is done every 2 years. So, yeah.
Leap.
It's a big leap. Yeah, it would be down to about 25%. So
I actually noticed
yeah.
it went up in this reporting
It
document
did go up
too.
in this reporting,
So
absolutely.
It went
So
from the 28 to 29.1.
Yes, absolutely. So, yeah, it went up a little bit. And we actually saw that throughout the state. It went up a little, like almost a percentage point throughout the state as well. But in general, we have seen a decline in alcohol use in Missoula over the last 6 years, and in Montana and throughout the US. But
Is that correlated to medical marijuana and marijuana use? Because most of the correlation studies point to marijuana use causing a massive decrease in alcohol consumption.
We haven't seen a huge jump in marijuana use really in the last few years in Missoula. It stayed around 20%. So I wouldn't say that that was a direct correlation. We have seen a general decrease in most substances across the board for youth, but an increase in depression and anxiety.
That's crazy.
Yeah, it's really interesting.
Do you think that those are related? Or?
They're just, kids are not necessarily going out.
It sounds like self-medicating.
Absolutely. Yeah, it's really fascinating. I don't know if we can show a direct correlation between like one drug or the other. Yeah.
Or has measurement of depression and anxiety just increased?
Not really. I mean, I would say, and
it's hard to
we
know
have a
with
suicide
self-reporting.
prevention person over here too. So.
I don't know that the measurement has changed though.
Yeah, I don't think it has.
The means of measurement for depression and anxiety haven't changed.
Yeah, if you talk to anybody that works in schools, I mean, they will tell you that kids are more depressed these days and kids are more anxious. So, yeah, but we do know that we do have a problem in Missoula with drinking and with some other drugs as well. So, reducing that will ultimately help our citizens be healthier in general. So.
Well, because you brought this up, but maybe it's more. How do our incidence or rates of depression and anxiety compare to other places for youth?
We are the number one. Montana is number one in suicides in the nation.
But I didn't ask about suicide, about depression.
Oh, depression.
And anxiety.
Yeah, that's true.
I don't know.
It's okay.
Yeah.
You just said that they were high, so I wonder,
are
they high compared to Idaho, Wyoming, or Massachusetts?
Yeah, I would have to check on them. Sorry about that. I don't know the answer to that, but I do know that it's increased for sure. So, and that's across the nation.
Yeah. It'd be, well, if it's everywhere, then I feel like it's almost less meaningful for us than if it's just us.
We are definitely higher than than the rest of the nation in terms of suicide. We know that, not necessarily depression. So.
At least according to Google, Montana's #1 in depression.
Well, there you go.
So.
Is that youth or adults or just general speech?
Google Montana's ranking for depression, enter, it said #1.
Yeah, which I don't know.
Not scientific assessment, Google.
Say wrong, we're the happiest.
That's why we're being sold to Canada.
For $1.
I'm gonna sign that actually.
Yeah, we could all go up. That means we get healthcare, people will be happier.
So, so some of the objectives that we had under this goal, one was to identify and select an evidence-based curriculum in partnership with Missoula Underage Substance Abuse Prevention Coalition by the end of fiscal year 2019. So the Missoula Underage Substance Abuse Prevention Coalition has been around for almost, I want to say 20 years. But it was in serious need of revamping, and we wanted to make sure that we were doing effective work and not just being busy. So we wanted to make sure we were doing evidence-based and sustainable programs. So that first action under that objective was to go through a strategic planning process with a professional facilitator that actually Ellen helped us get, that will inform the selection of this evidence-based curriculum. The group went through that process with a woman named Rachel Gouen from Fifth House Consulting. And so I'm just showing a couple pictures from the strategic planning process. And just they were just
kind of showing a little bit more about how they wanted to work in more collaboration as opposed to, you know, just one or two people doing the most of the work. Before, the facilitator was primarily doing presentations with kids in school, but that program, it was up to her to do all of those presentations, and it wasn't necessarily evidence-based, and we want to see actual evidence-based programming going towards this serious problem. So,
who are the members of the coalition?
there are several, there are about 20 different regular members, but we have people from St. Pat's, we have Western Montana Mental Health Center, we have several different after-school programs that work with youth. We have Project Success, which is a program that does kind of the beginning of like identifying students who are at risk for developing a substance use disorder. So right now, those are kind of the main players.
Not the school district?
The school district, we don't have them attend the meetings, but we work a lot in collaboration with, and I'll show you a little bit what we're working with.
Crazy.
I know, yeah.
That is...
And it's... yeah, absolutely, no.
I want to use a bad word.
so we were...
The whole thing's being revamped.
Yeah, so...
It's a huge shakeup.
Yeah, and we definitely...
Carry on, sorry.
No, it's fine, yeah. And so, yeah, rebuilding this whole coalition and who is a part of it, and we really need to make sure... The coalition really went down just primarily working with people that do after-school programs, which is not really the best way to do that, right? It's only one place that kids go. So we are working with MCPS on a couple of things, though. So we are, so the action number 2, an evidence-based curriculum will be selected utilizing feedback from USAP's strategic planning process, local data, funding capacity, and considerations. We've continued this strategic planning process you know, for the last few months. We actually developed a core group that is helping move this along. But we really wanted to make sure that this was owned by the community and owned by the people that are part of the coalition. And so that process has slowed things down a little bit as opposed to us just kind of mandating this is what we're doing. But we are in the process of finally making our goals. This is a project, though, that I myself and a couple of other people from the Health Promotions Division are working on with MCPS, and that is helping them with their rollout of the PACS Good Behavior Game. And I'm not sure if you've heard about this before, but it's an evidence-based program that basically helps kids, it's a trauma-informed program that helps kids build self-regulation and to improve relationships between adults and peers. And it's shown to reduce suicide, substance use, and increase graduation rates. So all of those things all at the same time. This is a program for kindergarten through 2nd grade. Yeah, going back to actually helping kids develop those social emotional skills that help them when they are older and helps them to not decide to use substances. So this is really an innovative program and that we're really excited about happening. So right now it's in K through 2nd grade right now. We are hoping to get it all the way up into 5th grade. We're also hoping to get it into the other school districts that aren't included in MCPS. MCPS is only one portion. So we help to restart the behavioral health section of Graduation Matters. And so that's when we were partnering with MCPS, but they're not necessarily coming to our table yet. But I feel like if we are able to really work together with them on that, then we can really have a mutual relationship.
So this program's in action right now.
This program is in action right now. Who's delivering this? This is a program that's delivered by teachers. So it's a classroom management program. And so they're trained in it, and then they have mentors that help them throughout the process. And it's for like the entire, they're hoping the entire school can do these. And it's a really fascinating program. We're actually doing a training on Monday, the 25th, if anyone else is interested in coming to this, because we're really hoping that it doesn't just stay in the schools, that the parents know about it, and that they can use some of this stuff at home, that after-school programs can use it as well. So, but really thinking about what are those evidence-based programs that we can really affect children early on, as opposed to waiting until they're already using. So.
I just have one other quick comment.
Absolutely.
Because we've not been able to bring MCPS to the plate either on sex trafficking and victimization.
Mm-hmm.
And we know that that is a cause of depression, especially in middle school and high school girls.
Mm-hmm. Absolutely.
And it's not being addressed. So if you have any way to work that into your program, to tell them to watch out for the signs, because it's just been crickets. They know about it, they don't want to incorporate it into they don't even want to let us do clinics with the teachers on in-service days.
Yeah.
So they can learn the signs of it.
Yeah, so yeah, it's really interesting that there is, it's definitely this bubble, and it's hard to penetrate and to really get inside, or for them to come outside of their bubble, right?
However they feel about it, it's still happening.
Yeah, so I think, yeah, definitely talking with their Graduation Matters,
that's where we go in.
Those programs, like, they're really trying to get community input on those groups, and then also talking to their curriculum coaches as well.
Well, it's one of the signs of sex trafficking is medicating through alcohol and other illicit drugs and depression are some of the things we tell teachers to look for if we can even get to them. So.
And those are all, so connected. They really are.
We should talk, because my infectious disease nurses might be able to address some of that too.
Okay.
I think from a public health trend analysis issue too, I mean, to tackle youth use, you're gonna have to tackle the fact that over a quarter of adults are routinely binge drinking and normalizing heavy alcohol use in Montana or Missoula. I mean, that's a big deal because it's learned behavior, right? That if your parents are drinking every single night heavily, or almost every night, or even routinely heavily, that's gonna influence, you're gonna normalize that behavior no matter what.
Yep, and that's, I mean, that is definitely something that if we are doing something in the schools, we absolutely have to do something with it, with parents as well, because they are the #1 influence about whether or not kids decide to use. So.
The most interesting feedback I've ever gotten is I have a lot of business partners travel here to meet with us, and we go to a brewery or whatever. They're all appalled that the breweries all have play areas in them. Like from the rest of the country or the rest of the world, they're like, why does a brewery have a play area at it? Like, they can't understand that. So that's kind of anecdotal feedback from the rest of the country. When they come here to visit, they go to a brewery and they're like, there's a play area in a brewery, aren't kids not allowed where people drink? And I'm like, so the rest of the country, they don't normalize having children around alcohol as much. So anecdotal, but I thought it was interesting just from a normalization of alcohol use.
Absolutely, yeah, absolutely. That's really interesting. I also should probably.
Sorry, no, I'm sorry.
Okay. You guys should come to me, Seth, and we can talk more.
Yeah.
So another objective we are working on, which we have not completed yet, is an implementation plan that will be developed for rolling out the evidence-based curriculum. So that should be done in the next couple of months as well. And then objective 2 is increase outreach related to youth substance abuse prevention by placing social media posts, newsletters, radio ads. So that is an ongoing objective. I do want to let you know that there is a new program that we will be using that was put out by DPHHS and the Center for Health and Safety Culture. And this is really talking about positive norming. And so really looking at how can we talk to parents about this. And they did a survey of parents in Montana to kind of see like what their attitudes and beliefs were about alcohol. They found several things, but one of them was most Montana parents, 82%, regularly engage in a conversation with their child about alcohol and its impact on health and safety. So that's that really positive norming, showing that most people in fact do this, and most parents disagree with kids using alcohol. And then I do have there's radio ads and television ads. I'm not going to show you because we don't have enough time, but I can send that out if you'd like to see that.
I would love to see.
Yeah. And then also, an objective 3 is looking more at even younger children. So in order to increase the family domain protective factors for substance use prevention among youth, increase the number of families receiving evidence-based home visiting services from any organization in Missoula County by 10% over the baseline of 125 in fiscal year 2018. Missoula is very resource rich in some of these programs. We have about 8 to 10 home visiting programs in Missoula, and the health department is very strong in this. We have a few programs as well. And so we really want to make sure that families are utilizing these programs because we know that it can affect a number of outcomes such as substance use. And so one of the things, we developed a home visiting postcard that really shows the different programs that they have in Missoula, and distributing that is one thing we're doing. And then we are also convening a neonatal abstinence syndrome work group as well, and home visitors will be going in and talking to those groups that are working on that issue. So making sure that mothers who have been using substances are getting access to resources and home visiting. So, yeah. I know I
That's a lot of stuff.
Yeah.
Great.
Yeah.
You guys have really, really zoomed forward from that strategic planning.
Yeah, yeah.
And done so in the face of budget cuts. Oh, it's pretty impressive.
Yeah, we lost 2 people, so.
I would love to have a future discussion about influencer marketing in this space and how to utilize that aspect for getting the social media to be more impactful or whatever. We're just trying to, no kid's gonna follow the health department Twitter page or Instagram page or whatever, probably not. However, there might be some opportunities with some of the kind of influencer groups and stuff that exist out of Missoula. I think with Hank Green has his company that's based out of here and all that. We might be able to get a pretty high impact if we do it right.
So it add e-cigarettes into that campaign too.
Yeah, we could have a 4-hour discussion on e-cigarettes and FDA stuff and some of the stuff I know now, so.
All right, thanks, Leah. Next item is legislative update with Ellen.
Okay, I'm just passing out the sheet of where things were an hour ago.
An hour ago.
Caveat being, there are many more bills than this that we are involved with in the department, both through our city and county lobbies, but primarily through our public health lobby, our statewide public health lobby. So, and Missoula, of course, having the kind of support that we do have politically, is very involved and often very directly involved in testimony and so on and so forth. So these are the hot ones as of the moment. Senate Bill 179 is the title. That's not really what the title is, but a retroactive clause was added to this bill to preempt any local rules or laws being adopted. This is a reactive bill out of Yellowstone County. Yellowstone County used their health board authority to expand their smoking ordinances, and they survived. The health board actually prevailed on 2 court challenges. They were still found to be within their rights or under their purview to do this, under their authority. There are some folks that continue to be extremely angry about it. And so Senate Bill 179, which originally was going to preempt a lot of health board authorities, actually got drawn in a more narrow but troublesome way, and then it got amended to be retroactive. So I don't know how you retroactively preempt something. I don't think time works in that fashion, but that's what this is trying to do. And despite an awful lot of work and lobbying by both the city and the county and our lobby and everywhere, it does continue to move. So we're working.
Were there fines levied and stuff in that case in Yellowstone County?
No,
I wonder
it
if they're
wasn't.
trying to undo that. Huh.
They just didn't like it and had a way to, they did say on the floor, the representative on the floor did acknowledge that they were sending a message. He did use those words. So continuing to work on that. It's been important that not only health department members weigh in, but what has been extremely important, it hasn't stopped it yet, is that both county commissioners and city council have weighed in, because the bill says you can only do this if your city council and your county commissioners approve. And so to have the city and the counties weigh in and say, we don't want this bill. You know, we have a health board to do that. Now, one of the things we've had to work around carefully as we take our position in Missoula is we happened to have used city authority and county extension authority in our regulation. And we did that because our first one was way back in the early 90s. And kind of thought that it would be more likely to challenge, so we used that existing authority, as we did for the last round. So that one continues. 481 happens to come out of a lawsuit that you're familiar with, the litigation here in Missoula with the Fool's End Club. And this law, as drafted, is social clubs would be allowed, as long as they didn't have, quote, employees, to have smoking on their premises. Social clubs is not defined in any way. There's nothing about they would need to be in separate buildings or anything like that. This is also, unfortunately, moving. So we are all working against this. Shannon was over there yesterday on another bill and did some in the hall lobbying on this. For people who haven't been through that scenario and understand what that really looks like on the ground, might not think it's a big deal. But Girl Scouts could be a social club. And as our court ruling, even though it's been stayed, it did recognize that if a smoking entity is in the same building with those that are protected by the Montana Clean Indoor Air Act, it can't be there. It's being, as often happens at the podium, portrayed differently by the defendants of your lawsuit. That it could be there, it just needs to be clear.
So is there anything that currently makes it so that social clubs can't allow smoking? I mean, can't
There's
social clubs
there's nothing
already?
called a social club.
Right, but I mean, like the problem with the Fool's End Club isn't that they allow smoking, it's that it's where they do it. It's that they rent space in what we consider to be a public building.
I agree.
It's not that they
Well, and
are a club that allows smoking.
And the whole issue that our lawyers worked on intensively is that they don't have any employees. Now, the court.
Yeah, but the whole thing was with.
Right. So if we can't kill it, we do,
located.
you know, there has to be a mandatory strategy to have it go sit off by itself
Do
somewhere.
you know who the
but
sponsor of this bill is?
Which one? The Wiley Gulp.
481.
Wiley Gulp. I'm pulling them up right now, seeing what they're.
The testimony has been from our
They won
local.
by one vote.
Yeah, but
In the committee.
it didn't look like it was going to, so that's the thing. And now we're getting closer to transmittal, so things are zooming. They're very hard to keep track of them. House Bill 490, there are several raw milk bills. There are ones that are more dangerous than 490, and I didn't put all those numbers in front of you. And Alicia Johnson of this department has been the main testifier on that this year. This is our fourth go-round with this particular effort. The reason I put 490 there is because 490 started out with the intent of being a compromise bill. So all the parties that couldn't agree before were going to compromise. It came out as something that public health cannot support. It allows for very small 3-herd, no more than 10 gallons a day farm sales, which are not safe, but are relatively more manageable with significantly less population exposure and better ability to trace back and to know what you're drinking. However, it then has a provision for an unlimited amount of sales out of grade A dairies, which makes it sound safe because they're grade A, but there is no safe way to deal with milk other than to pasteurize it. So it's being sold as a compromise. While we acknowledge the intent, it's not a compromise, and we are, just this morning again, I sent something over to your shop to try to acknowledge that, that we understand the good intent of a compromise, but that this bill didn't make it. And then to remind our folks, because our Missoula folks stand against this, but now they're saying, oh, well, this is the compromise bill. We've done this for 4 sessions. To remind them that Missoula was the epicenter of the last large grade A unpasteurized milk-borne outbreak, and that we'd like to remain the last and not revisit this. And no laws were broken at the time because there's no safe way to do this. So I wrote some stuff that I hope your folks can send to certain of our representatives. House Bill 575 comes out of Ravalli County, Representative Manzella, and it changes all DPHH requirements for immunizations in daycares to recommendations that could be unenforceable. So there could not be a daycare in which you could know that what your immunization rate is safe to put your infant in. That came up rather quickly. We were already working the House committee on that, and I think it was yesterday the majority party got it sent over to the Judiciary Committee, which is a whole different animal to work. So that's going to House Judiciary, and I believe the hearing is early next week. I can't remember if it's Monday or Tuesday. This is all based on choice, and as you are probably aware that it is already very difficult across the state, certainly in Missoula, to find an infant daycare. We have 3.6 families with an infant or toddler needing daycare greater than the actual number of slots. Wow. So this would make it more difficult for a family with a non-immunized child. House Bill 231 is more nuanced. This is, again, the 4th time we're working on it. It's really big pharma, box stores, wanting to be able to give immunizations without any medical oversight, standing orders, agreements with doctors at all. And Dr. Roberts negotiated the 2015 agreement as to which would be safe and which wouldn't be safe, and we had a negotiated agreement and a compromise bill, but there's no institutional memory of that, and so this was, we wanted to get it amended to allow flu shots. There's definitely the ability and a safe way to give more flu shots. They're needed every year, more kids need them. We do believe pharmacists can give shots, but entirely free of any medical oversight, and the fragmentation and safety concerns on that is why we've been fighting.
What do you mean fragmentation?
So if you've got a kid at 2, 4, and 6 months that should be getting a well child check, and they could go to any pharmacy and get what they think is the immunization they're supposed to get.
They don't get the well child.
They don't get the well child check. They're also not required to use a state registry. So what brand did they get for their DTaP? What? It's there's again it's being sold as this is access. There are places where again we agree there should be better access. But not this wholesale. This is to get the foot in the door to do actual clinics in the big box stores is really how this has been done in other states. So there are places, PHC for example, you've got a good pharmacy setup, you've got medical oversight, you have those things in place where who administers the shot doesn't become the biggest issue. These are outside of all of those structures. Includes live vaccines, so on and so forth. So
Interestingly, one of my other hats is I sit on the State Family Physicians Academy board, and we talked about this and actually decided we could live with it if for kids over 7 if they would just use the registry.
And they don't.
And they're not.
It's like we'll use the registry
which allows anybody else to see this child has had this vaccination.
Why wouldn't they want to do why won't they do that?
It's extra work.
Well, there's
too much money. It's extra work.
Yeah. The kids there give the shot. You may not even know which second meningitis shot you're supposed to be giving them. We have adults come in, they have no idea what they got at whatever pharmacy they went to.
Yeah.
I mean, and it's not been put on the registry. So our amendment had a registry use requirement. It went down to age 7 for flu shots, but allowed the 2015 shots that had already been identified that really targeted a lot of those teens, the ones we were talking about earlier. It allows those to stand, but our amendment didn't get adopted. So. Let's see, we do have some positive things. The Missoula initiative to allow the use of junk vehicle funds to remove non-motorized vehicles, such as, quote, mobile, non-mobile homes, is still moving along, and Shannon went over to support that again yesterday. House Bill 55, which was a big problem 2 years ago because it was a proposal to change the sanitation and subdivision process at the state level that was really injurious at the local level. So Shannon and Gina, we worked very hard to get that bill to have a, what do you call that when it ends in 2 years? You have to come back in 2 years.
Sunset.
Yeah. So they participated in that process for 2 years, and House Bill 55 is the result, and that is moving forward, does have some amendments. So that's the stuff that's going on.
All right, and now we move on to another action item, which Nancy's going to walk us through, is discussion and possible action on suicide prevention.
I asked to put this on the agenda because we are often very clear during this rapid and busy legislative season where the board wants us to stand on things. And even though I don't have a specific bill in front of you, you did hear on the suicide report update that one of the bills afoot does involve firearms. And I know that that's a controversial issue. I wanted you to understand and us to get a general sense of where our staff could go in lobbying or working on these. So, Nancy?
Thanks, Ellen. I'm Nancy DePastino. I was in front of you guys just about a month ago or so I'm going to try to not be repetitive, but do want, let's see, did I just go to slideshow here? Beginning, okay. But I do want to explain first a little bit about what the problem is. So we talk all the time in suicide prevention in the community and what we do about how means matter. And we educate people on safe storage of firearms and prescription drugs and all that stuff. This is where we are with that. We have, and you guys, I just passed this out, the highest rate of suicide in the nation, which is not going to be news to any of you. And it's actually 29.6, sorry, I have a mistake right off the bat. But on your sheet right here, that's telling us where we are, and I highlighted it for you in case you couldn't find Montana on there. We're right at the top in all of these things. The national rate of suicide is 14.5%. Firearms are the chosen method of roughly 68.5% of the suicides in Montana. So that's 213 out of those 311 suicides are by firearm. And that compares to about 50% nationally. And of the Missoula County suicides last year, this information is from our sheriff's office, 75% were by firearm. So we have an issue there that we need to really be paying attention to. Why are guns so important in suicide prevention? Well, they're lethal. They're the most lethal way if you're in suicide. 85 to 95% of all suicide attempts involving a firearm will result in death. And compare that to intentional overdoses, which is by far the most common attempt method. Those result in death 2 to 3% of the time. So, yeah, a huge difference. Yeah.
So that gets to your comment. All those attempts and just 2 to 3%.
Right.
That's lower than I would have guessed.
Yeah, the point is if you use a firearm, it's a sure thing.
Yeah, I get that.
And suicides are often a very impulsive act. So if you look at this graph, it's pretty shocking that about 25% of people who attempt reported making that decision to take their life and actually doing it was less than 5 minutes. 5 to 19 minutes, another 25%, another 20, almost 25%, 20 minutes to an hour. So this is usually a very impulsive act, and if there's a gun around, it can be a deadly result. I got this from the American Association of Suicidology. I just wanted to read it. Reductions in overall suicide rates highlight the fact that when an individual is prevented from using a specific method to die by suicide, they do not simply find another way. The effective means safety, however, hinges upon the lethality, popularity, and accessibility of the targeted method. As such, means safety efforts in the United States must focus specifically on firearms in order to have optimal effects because firearms are the leading method, the most lethal, and easy to access. Now, this is a national organization. They're not even talking about Montana's higher rate of firearm suicides. So what can we do? What we do right now is we do safe storage education. Whenever we go out and do our suicide intervention trainings, QPR, we talk about safe storage. We hand out gun locks from my office, and whenever we go out into the community. And then, you know, the law enforcement can ask for a voluntary surrender of firearms for their crisis calls when they do welfare checks. All those things that we do still lands us right here. And so, what should we be doing? A red flag or emergency response protective order is a law that 14 states have adopted so far. It's a suicide intervention tool. It enables family members or law enforcement, and just those two options, to temporarily remove guns from a person in crisis. So there's two kinds of these orders. There's the ex parte, which is immediate. It's you know, if somebody is in crisis, then law enforcement can go over there. They can get a court order and go over there immediately without a hearing, but that can't be more than a temporary thing. Then there's a final ERPO. So how these work is a family member or law enforcement can petition the court and ask for an ERPO. Then a hearing must take place within 14 days of the court receiving this. If the court finds there's credible evidence, so this is not just a flippant, you know, I'm annoyed with my neighbor, you know, kind of thing. This is credible evidence that this person is at risk of harming themselves or others. Law enforcement then will remove weapons in their possession. Then the ERPO can remain in effect for 14 days and up to a year, at which point a judge decides if it should be extended, and that respondent can request to terminate the ERPO once every 12 months within this order. That's a lot of information right there, but this is kind of boiling it down as simply as I can. So how is this working in other states? Like I said, there were 14 other states that have enacted this. There was a study that came out this past summer, and they studied the effect of ERPO laws in Indiana and Connecticut because those two states have had the law on the books the longest. And so in Indiana, their gun-related suicide rate was 7.5% lower in the 10 years after the law was enacted. And these are the raw numbers. So they basically saved 383 lives by this law. And then in Connecticut, interestingly, in Connecticut, the law was not heavily enforced when they first adopted it in, I think, 1999. They didn't start really enforcing it and getting out education about the ERPO law until the Virginia Tech mass shooting. And then after they did that, their gun-related suicide rate the drop in it went from 1.6 to 13.7 after they started actually enforcing it. So what I'd like to do is to think about what would it look like in Montana if we could reduce the firearm suicide rate by 13.7. We would save 30 lives a year, which I think is incredibly significant. And finally, I just want to share this support from Sheriff McDermott, who says the rate of completed suicides and those involving firearms is truly an epidemic across the state of Montana and within Missoula County. Currently, there's a lack of options that allow a law enforcement officer to take precautionary or preventative measures to separate a person deemed to be a threat or danger to themselves or others and/or a person having a mental health crisis from having access to firearms. So he's just talking, he doesn't have the tools that he needs within his power. Having the option of obtaining a court order in an emergency situation that prohibits these folks from having access to firearms until such a time a due process hearing on the matter can take place would undoubtedly save lives and enhance the safety of our community. So
the bills are really titled domestic violence bills, because of course in that larger arena it is domestic violence. It could result in homicide or suicide. We have had legislators ask for more information, and we would like to feel like I'm interrupting.
No, I was ready to.
We would like to get a sense of board support for doing that.
I just would say, in conclusion, I think that I appreciate Sheriff McDermott's statement so much here, because law enforcement really needs this tool. They are the ones on the front lines going out on these crisis calls, and when it's too late and deciding that this is a suicide. We need this tool in suicide prevention. I think that we can give out gun locks and talk to people about safe storage until I'm blue in the face, and everybody who works in this is blue in the face, but we are not going to make a dent until we do something that can help us remove firearms from somebody in crisis.
So you're asking for board encourage, what specific, say that again specifically?
Just a discussion of general support, or if you feel that it's too controversial for staff to weigh in. We can't put something highly specific in front of you right now, which would be the normal course, you know, with the words and this and that, because we don't really know this moves too quickly. We don't really know what's going to come out. But I know that the board supports us in, you know, getting out there on raw milk. And I know that the board supports us on certain subdivision things. And I know the board supports us, you know, to lobby in whatever direction we need to on things like immunization. But we haven't had this discussion, because, you know, as it relates to firearms.
So I see it's an action item, so do we have a proposed motion?
I could make one, but I should, but let me just do that.
Do you know, I think the organization is POST, the law enforcement officers. Somebody here is going to know what that acronym is.
I'm sorry, what was,
POST, Peace Officer.
It's the POA, like the MSPOA or something?
It's POST, anyway, it's the organization of law enforcement officers in Montana, and they have a lobbyist, and they have
Right, yeah.
So I wonder what they think about this.
You know, I work closely with TJ McDermott, and he's been fantastic. To be honest, I think that sheriffs in general are a little bit worried about, you know, touching any gun bills, which is a little frustrating because they're the ones who are on this front line.
They also are clamoring for tools to deal with this.
TJ is,
he's willing to come forward.
Very willing.
My guess is he's a minority in Montana.
Well, I don't.
Publicly.
Yeah, I think it's
yeah, publicly a minority
in
Montana.
But I think the sense that I have gotten just from, you know, talking with folks about this is that the Sheriff's Association isn't going to get involved in it. I think that, you know, well, I won't say that anyway.
So Missoula County, City County Board of Health supports the staff advocating for the passage of red flag laws that allow for temporary removal of firearms with due process in times of crisis as a means to support, to prevent suicide.
To bring out the word suicide.
So we don't currently have a bill.
Well, there are some,
there's an LC.
but
There's LC number.
There's an LC number. It's
it hasn't been introduced, so we
Right.
can't see that.
Well,
When's the deadline?
When's the deadline? That's how I was.
You know,
a couple weeks or less.
I believe what happened is it stalled because they decided it was going to be a revenue bill because with court fines and honestly,
so if they named it, if they called it a revenue bill, and I'm sorry, this is a moving target. I just wanted to take advantage of this opportunity to get some of your thoughts. But I couldn't put the target in front of you. If If it was ruled a revenue bill, then transmittal date isn't till like another month from now.
Right.
So if it's not a revenue bill, it needs to be introduced ASAP. In the meantime, we had legislators asking for Nancy to go over there, which she did, and she's always allowed to provide information, and she did. But to be called upon to say, yeah, go ahead, Nancy, you've got the support, or we've got the support, I felt like we needed to check with you to move in that direction.
Yeah.
I think you have my support.
Yeah, my support.
Right. Supportive. It's odd to me that like healthcare and mental health professionals aren't among the group that could also request sort of emergency removal.
Well, I think that the reasoning behind that, and that is the case in some states that have this law, they don't want to discourage people from seeking mental health help because they think that their guns will be taken away. That's the reason that it's so narrowly written to be a family member or law enforcement.
Just from a political strategy perspective, I have a hard time imagining that anybody with Missoula County in their job title is going to be an effective advocate for this at the state level.
I know. But right now,
So, are we helping or hurting the effort by sending some of you to?
That very same thing. Like if we were really to be strategic, would be the best thing to do is for Nancy to work with your
Counterpart in Billings.
I do, yeah, and
she does.
we will
that
talk.
person do it.
Yeah, there's a lot of.
We do that a lot. We
Yeah,
actually,
especially now with what Tim Fox is doing because of what the city council did, that it's tainted with the word Missoula on it.
it is, and Nancy wouldn't necessarily be the face, but to truly be over there in any way lobbying, I really feel that the staff needs that support from the board to do that, because we have not discussed.
It might be the wrong thing strategically, but it's the right thing.
Nancy, are you allowed to lobby for this?
I can educate legislators,
And
so I
inform.
can, and boards like this, and, so give my suggestions of what I think would help in suicide prevention. Yeah.
I might be the sole dissenting voice on this subject, but more in the terms of I'm very loath to have any kind of community or like on a county or city level have anything that impacts potentially constitutional rights. The most important thing for me being like, yeah, I'm behind it, is to make sure that those words temporary stay in there. Like, not like this can be open-ended. I don't even like the idea that it's open-ended for a year, right? Like they talk about a judge being able to extend it that far. Temporary, I think, should really be temporary in any kind of thing like this, because then it does tread on the grounds of restricting people's rights, which then leads to a challenge in the Ninth Circuit Court, and then, or whatever circuit we're on, I forgot now all of a sudden, and then a challenge on a constitutional level, which becomes really expensive on a county. And like if we do something and it gets ordered and then it ends up in a Supreme Court lawsuit, that's really expensive for local government to have to deal with all the way through the end, and something that happens like that. And so kind of my perspective is I'd want to make sure that temporary language, if you wanted my kind of voice and support behind it, was a key component to that. There was a temporary removal.
So this is helping me draft a motion.
And
And that's just my sole dissenting, like I said, I might be the sole dissenting voice on that, but the temporary is important to me.
You said like 14 other states have something similar.
That's true.
Are we learning from them? Are we using the language that has worked and
I
has
think that,
stood the test of time?
Yeah, no, I do think that, I'm obviously not the person who drafted the bill, but I do think that they're kind of models for these types of laws now, especially since there have been, all 14 of those laws are slightly different, so they're working with what would be a model Urbo bill, I think.
And do you know if there have been challenges to any of those laws?
I don't know.
I do recall reading about one challenge to one where the guy did get his firearms back even though a judge didn't want him to. I can't remember where it was at, but they won the lawsuit challenge.
But it wasn't.
So.
But it wasn't a challenge on the law itself. It was a challenge.
It was on his specific incidents.
Right.
Yeah,
That's
so
all
it
right.
wasn't.
That's
a
built into this. That's great.
I guess
Go for
I'm
it, John.
confused as to why this would not be an extension of a 5150, which is only 72 hours. Because that is, you have the intent to harm yourself or others, right? So why would we not just extend that law already on the books and say this extends to?
Don't we have to remove the person in that case?
Well, you can, but the premise is the same. It's a 72-hour hold because you have the intent to hurt yourself or others.
You know,
I'd be all for
I
that.
wish
I mean, I'd
Anna
be
were
100% on
here
board.
because the familiarity I have with actually making those commitments through the court is not as easy as it sounds. It's very difficult.
What's a 5150?
So it's a psych hold, so if you're determined that you are going to harm yourself or harm others, the police can take you into custody and enter you into a medical psych hold program. So they would take you to the hospital and admit you with or without your consent. But to me, this would just be an extension of that type of authority, is that you've been deemed that you're going to harm yourself. So why would it not just be like a 72-hour kind of?
I only have personal experience on that from 2 years ago, and we tried to do that to somebody, they wouldn't do it. And they were threatening to kill themselves. So like, they would not do it in Ravalli County whatsoever. They said, no, we won't do it, when we tried to get it on someone who was actively threatening to kill themselves.
It's a big deal to be done here. You involve a county attorney and a health evaluation.
It's not just
a judge.
They're in trouble.
Yeah,
Let's
it's
put
serious.
Somebody has to
serious
take them.
business.
But I
And
think
some are
that's-
serious, like
right.
4 levels of
But
it.
that's a removal of a person to a medical facility. This
Right.
seems like, to me, it's a natural extension of that if you want to remove their firearms for a period of time, or you want to. I'm a little concerned with the whole year-long thing, too. That seems a little, I mean, people mentally heal pretty quickly if they're going to. A year-long's a really long time.
Well, I think it's not 14 days or 1 year. It's up to 1 year.
And
You know, so I think it's
for the
it can be the
purposes of what
situation.
we're doing right here, right now, you could just say temporary.
Yeah.
Or we're just saying
Right.
explore this and see if there's
Yeah.
support.
Yes.
We're not wordsmithing an actual bill here.
No, that's why
So
this
I
was
think just-
difficult, but this is exactly the thinking and
I
discussion
feel
I
like just
wanted
the
to
word
provoke.
temporary is good enough for.
Let me try this. Let me try this. Go ahead.
I had one other comment, and it kind of ties into the quarantine thing. My other concern with this is based just on Montana and who lives here. Is this going to increase violence against peace officers in Montana too? So I'd have a concern about that if we're putting, that would be one thing I'd be interested in understanding if that would have an impact. Doesn't necessarily affect this, but that'd be my peanut gallery comment as well, as we do have a higher firearm ownership. There is a risk when people feel like they're being infringed that they would use violence or whatever to protect their rights or whatever. And so I'd want to be cognizant of that.
And there's like this missing gap about where's the treatment part of it. Okay, you're removing firearms because the person's going to harm themselves. What are our intentions to help them? You know, or do we immediately place a counselor there? Do we immediately?
Well,
You actually sold me on the time decay. When you
But-
showed me the time decay thing, just
Right.
removing that opportunity
that's-
seems to almost self-cure.
This is
That's
not
so
an
weird.
either or.
Yeah.
Yeah.
No, you know, and the titles of the laws, this one thing you can get is the titles of the laws, and it, even if you don't have the language, and it really only focuses on temporary removal, domestic violence situations, but we know those result in suicides as well. So you really can't move outside of that narrow title of the bill. That doesn't mean things don't exist outside of the narrow title of the bill.
I'm all for it as long as it's a temporary period of time that is defined. Because then you don't have people saying, you're taking my guns into custody and I have no recourse. Right.
It seems like what we're kind of beating around here is a reticence to, and a caution, I should say, maybe better words, a caution to take action on supporting something that we don't know exactly what it is.
I think we can support it in theory, but I think if it is too heavy-handed, it'll never pass in Montana.
Right.
It has to be the right thing, the right nuanced
Oh,
thing.
the
And
first year
everything-
you do it, it's
everything-
usually
Never gonna pass
informational.
Yeah,
You
everything
don't
needs a
pass.
step, first step.
Right. But for me, when I get a question from staff, can I go over, can I do this? And I go through, you know, we do a little training and lobbying. Yes, you can, because it's informational. Go fight for it, because the board has always fought for clean water law. You know, I mean, early on, it was, you know, go fight for tobacco law, because we had a resolution 30 years ago. This is more narrow. Nancy was being pulled in, and I thought it was a good opportunity, even if we don't resolve it, to start to have this conversation. But I would like to try, based on the language I've heard, to try a motion and see, even though you won't be able to see it, but I couldn't try this motion without hearing you. It was chicken and egg. Okay. Missoula Board of Health supports the department advocating for, quote, red flag, end quote, because I don't know what they'll call it, policies with due process, allowing temporary removal of firearms during a crisis as a method of suicide prevention.
I have no opposition to that language.
I'm fine.
Did you get it?
Can you read just the last part again? So
With due process, allowing temporary removal of firearms during a crisis as a method of suicide prevention.
I really want to be cognizant of our strategic goals about marketing and community acceptance and interfacing with the community in a lot of these discussions with this. Because there's already, Montana has an innate distrust towards government organizations. So I want to make sure that we're balancing that constant ratio with trying to get help in our other avenues that we're working on and impact, and making sure we kind of keep, at least keep it in mind. Like how comments like this or whatever on MCAT were on record. And that reminded me that.
That's
the
why I
other
brought
day.
it. That's exactly why I brought it.
And realistically, if you're talking about drumming up support, you're gonna go speak with legislators. That's different than using Hank Green as a platform to get the word out about vaping or something.
Yeah.
We're only gonna reach a very thin band of people through MCAT who are really interested in governmental
Trust
affairs.
is trust, though.
Dude, I'm not saying we're
Yeah.
trying to
Yeah.
hide and we're being open about it,
Yeah.
but there's one level of promotion and another level if we're just doing our
Yeah.
business.
Kind of along the lines that James was bringing up, did we achieve our requirement for public notice on this? Since it's an action item.
Oh, that's
It says possible action item, that's why I put it that way.
Yes.
Discussion and possible action on suicide prevention and Bill LC 1516.
Right, I'm just wondering if we
entitled-
met, because we've got a, I
This
don't
was a
know when.
revised agenda, but it went out Friday, right?
That was already on the
It was on
agenda.
That's, I was just double checking
Yeah.
that that went out in time,
Yeah.
that we had
Yeah.
met our
Yeah.
public notice obligation requirement.
That's why we did it that way, and it's specifically about that bill. We just don't have bill language,
Okay, all right. That was
not
just-
released.
And that's a
Double
domestic
check.
violence bill, you said? Okay.
Okay. Well, I guess at that point, we'd be looking for a motion.
I thought James made it.
Yeah, I can,
I
what do I need to say?
Do you
I
wanna-
have a motion to support what was stated.
Let's
Do I need to read
Let's let
it?
Julie read it back, or I'll read it and
Yeah,
see if
we
you've
need
got
to.
it. Yeah. The Missoula City County Board of Health supports the department advocating for, quote, red flag, end quote, policies with due process that, that allow, with due process, comma, with due process, temporary removal of firearms during a crisis as a method of suicide prevention.
That's your motion.
That would be my motion, because I
Alright.
won't remember how to say it exactly
That's
like that.
perfectly said.
We've
That was
got a
pretty good
motion.
chicken egg experience.
We've got a motion on the floor. Any public comment on the motion? Any further board or staff comment or discussion on the motion? Seeing none, all in favor say aye.
Aye.
All right, so moved. Thanks, everybody.
Thank you for bearing with that.
Yeah, thanks, Nancy.
We're clean, we're clear.
All right. In the interest of time, we've just burned 2 hours and 20 minutes. Deb's offered to move her journal report to,
The end.
Or-
Well, let's burn through everything and maybe we convene
okay.
if we have time today.
All right, so item number 10, skipping to item number 10, Director's Report and Accreditation Update.
Okay. We have had a health emergency advisory team called HEAT teleconference. Cindy alluded to it on measles, and we will have more and are working internally on that. I will have for you, I believe at the March meeting, an action item, different topic now, to sign and enter into an agreement. It's a very general agreement with the University of Montana School of Public and Community Health Sciences to jointly be recognized as an academic health department. So we'd basically be recognizing under the Council of Linkages between schools of public health and public health practice institutions. We'd be recognized for many of the organic bridges we've already built with our internship work, some of the research, some of the consulting that we're doing, supporting each other's accreditation, so on and so forth. So we thought it was time to formalize that. And I have the, as of yesterday, the verbal agreement and the draft agreement to do that. So I hope to bring the director of that program, Dr. Tony Ward, to the March or meeting soon thereafter and get your action on it. So that's great news. And that's it. We'll move on.
And you're filing the accreditation paperwork within 2 weeks, is that what you said?
Mm-hmm. March 15th, we selected the Ides.
Cool.
All right. All right. Well, I think, why don't we...
Do you want to go ahead and do it?
Why don't we save it to the end, and so we
Okay.
don't short anything else.
Okay.
So with that, we will move on to item number 11, public comments on items not on the agenda. Seeing none, any board or staff comments on items not on the agenda?
Oh, go ahead.
Not today, but at a future meeting, I would love to have some kind of public board conversation about what you all are working through with regards to measles, because I think it would be interesting for public consumption, how we are thinking about responding to an outbreak of something that we haven't seen here in a long time.
Let's cruise through business. That is
Let's
my
do it.
journal report is on
Let's do
measles.
it.
And I thought, oh my God, if we wait until next month, we're gonna have a case. I just want to know.
It's one of those things where my age comes in handy, because
So, I mean, it'll give us an opportunity
Yes,
to talk
let's
about the
do it.
heat and everything, and Ellen and I have talked about it some, but I just want to be sure we get through everything, because we have other action items still.
Yeah. Any other board or staff comments?
I was just going to say, and Nancy stepped out, but I was going to say, you know, hats off to Nancy. She was Monday's Montanan in the newspaper for the work that she's doing on suicide prevention, and that was really great press for the department and for her.
I have a quick one just to get on the record. I recommend to you, this goes back to our housing discussion. There's a lot of good literature out there. There is an absolutely excellent book called Evicted. Can't think of the author's name, but he's a MacArthur genius, about the real housing experience and evictions in Milwaukee. So those of you that are interested in what happens on the ground as well as data, Evicted is highly recommended.
Any other board or staff comments on items not on the agenda? All right, seeing none, we will at least temporarily adjourn as the Board of Health, and we will convene as the Water Quality District Board. Do we have the January minutes?
Yes.
Yeah.
Okay.
I move to accept the minutes as presented.
We got a motion on the floor. Any public comments on the motion? Seeing none, any board or staff comments on the motion? Seeing none, all in favor say aye.
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 So moved. All right, next Travis is gonna help us welcome our new hydrogeologist.
Yes, thank you. Can I stand here? No.
No, you know that.
We'll move over here.
We should have our microphones by the end of the month. Keep
We
getting
should.
updates.
So I just wanted to introduce the board to Elena Evans. Elena. Yeah, thank you. Thank you.
Hello.
Hi.
We're excited to have Elena as our new hydrogeologist, this is a new position. We believe she's going to be able to help us with a number of things, including cleanup sites, evaluation of plans, groundwater monitoring plans, helping us with our own groundwater monitoring network and surface water network as well. Elena has worked in private consulting and with the State Department of Environmental Quality and Association of Conservation Districts, and most recently with the city. So we're happy to have her, and just wanted to introduce you to
Great.
Welcome. Yeah.
Welcome as a recovering hydrogeologist. Still recovering.
When are you going to be a recovering lawyer, you think?
I'll be someday. Just recover as both of them. So, all right, with that, we move on to Todd's gonna walk us through a Water Quality Advisory Council update.
So I'll keep this really brief. I'm Todd Seib with the Water Quality District. Our last meeting, our main two kind of focal areas were legislative kind of updates. There weren't too many bills that we were concerned about, but we did discuss a couple of those, specifically the water quality variance bill, SB 48, had a hearing last week. I don't know if you want me to say anything more about that, but
If you could briefly summarize the bill and where it stands.
so basically, there are nutrient standards for rivers, for surface water. Don't want too many nutrients in the river, and right now, there are a lot of wastewater, discharges throughout the state, mainly small rural communities that can't meet those standards. It's my understanding you have a river body that's naturally, impaired, or it's such a small volume of water that it's really impossible for these small towns to meet those nutrient standards. DEQ is the one who's putting this bill forward, and basically what this would allow DEQ to do is to provide rules for variances for these communities, as opposed to, say, changing the nutrient standard altogether. So there would be controls in place, like 5-year review of discharge, and they'd have to, perform some quality control of what they're doing. But the council didn't really have a lot, or they didn't have a lot of opposition to this, just more of a discussion, try to dig into a little bit. There were some other aquatic invasive species bills being introduced and some other things. At this point, the council's doing a lot of monitoring, I would say, but we don't have any red flags that we see we need to take action on.
On the variance bill, as written, would those variances go directly to DEQ in all instances?
DEQ would be the one that would write.
So it's not it doesn't open the door for such variance requests to go through local?
Not the way I understand it.
Okay,
the bill's
straight through DEQ.
The bill's been rewritten, I think, 3 or 4 times since it's been introduced. So.
Great.
The other main thing the district is doing, or the advisory council is doing, is just working on some educational outreach, developing some good signage and graphic design work for Jacobs Island. And right now, the main topic is the Rattlesnake Creek and restoration and kind of history of the dam of that watershed. And we're going to talk about Smurfit Stone and the Missoula Aquifer and Glacial Lake Missoula and a number of other topics, and it's going to rotate through on that educational sign at that location. So there's a number of different subcommittees working on things, so we're all kind of excited about that. We've hired a graphic designer who's got a great history in designing these kind of watershed educational displays. So, yeah. Cool. Anyway.
All right, good deal. Thanks. All right, thanks, Todd. Public comments and items not on the agenda. Seeing none, board or staff comments and items not on the agenda.
There's one
You bet.
thing I was going to ask Ross. Travis. I'm sorry. Sorry. You heard the story? It was kind of a long form story on Montana Public Radio about the waters of the U.S.
I have not heard that.
It was like a 15-minute thing. I was just wondering, given what you were here talking about last week, what you thought about that, because that's kind of like the version of waters of the U.S. that's out there in the greater Missoula world. That's what people would understand. I was just wondering if you had an opinion, if you thought they got it right.
No, I will listen to that. So it does come into play in a number of the I guess bills that are out right now, including just when you're looking at discharge permits and variances to standards, and definitions of surface water. There's always a bill like that to determine what's perennial. So I'll take a listen.
Yeah, it's just like 2-3 days ago.
Yeah, they were announcing that the comment period is open for comments, and it does have a fairly heavy ag influence
Absolutely.
into the discussion about the rollback.
Yeah, they interviewed Hans McPherson, who's a old-timer farmer in the Bitters, but a really well-known person, who's also, I think, the head of the Montana Farm Bureau, and he was headed off to DC to go present at the National Farm Bureau meeting advocating for the current administration's rollback of the water supply.
Oh,
yeah.
Interesting. Yeah, opens it. Well, actually, it narrows the definition.
That wasn't the
so that's
tenor of the report. They just interviewed him and then interviewed other people too, but I feel like that's the piece out there in the greater public conversation about waters of the U.S. Would hear what we thought.
And that irrigation exemption was in there in 2015, so I feel like there's a lot of misinformation on that the irrigation ditches and puddles would be regulated under that 2015 definition, but that's not the case. Those are specifically excluded, so.
Yeah, after you hear this, it might be worth, if you believe it, if they portrayed this inaccurately, it might be worth it for you to send a letter to Montana Public Radio.
Okay.
Or the Missoulian or something like that, because this is what's out there in the public.
Yeah.
Well, the agriculture pretty much hates all rules anyway, so they'll say no and then do it no matter what rule goes through if they can help it.
He did say rules are necessary. I mean,
He
that
did.
was a part of the text.
Yeah, that was one of the first things he said. It's a good memory. That's one of the first things he said. He didn't sound crazy at all. He's not a crazy guy.
No, he's
Hans
great,
is
actually.
a pretty good
Yeah.
guy.
Yeah.
I get the note from him.
There you go.
All right, any other board or staff comments on items not on the agenda? All right, seeing none, we will adjourn as the Water Quality District Board, and we will convene as the Air Pollution Control Board. And the first item on the agenda is approval of the January minutes. I presume that's a typo, that'd be the January 17 minutes again.
17.
I'd say 17.
It says it on the, yeah, it should be 17, sorry about that.
Remember that one?
Sure.
I read through it.
Okay.
I'll make a motion, we approve the minutes.
Got a motion on the floor, any public comments on the motion? Seeing none, any board or staff comments on the motion? Seeing none, all in favor say aye.
Aye.
Right, so moved. All right, so Ben's gonna walk us through the Air Quality Advisory Council update.
You're walking fast, too. You run the clock down. Puts pressure on you.
All right.
Sorry.
Okay, giving the update on the Air Quality Advisory Council meeting minutes. The article presentation was about the state of science during the Trump era, and also and this is all from the Union of Concerned Scientists, was science integrity and the losses and lessons for the 116th Congress. So basically, it was an article given to the Congress saying this is what we should do to protect science. And a big emphasis of the discussion of the group was the fact that science has great benefits to public health and well-being and everything, and the attacks on science really need to start being addressed.
Was that from the National Academy of Sciences?
Uh,
Because my daughter wrote that. I'm sorry.
That's pretty great.
Maybe that's not that one, I'm sorry. Try not to do that, but she came back and she said, I was so nervous, I was the only non-PhD in the room. And I said, well, you should have been nervous that you were the only non-National Academy Science member in the room. She goes, oh God, I'm glad I didn't think of that.
So anyway, that was the basic article presentations, and
they're still in session, huh?
oh yeah,
So they're talking.
116th Congress still there. Then we went on to the action item. They nominated the same chair and co-chair they had last year, Bert Chesney, and Kathy Tonneson. Hopefully I said that right. So they'll be the same. And then there was an update from Ronnie Flattery. She's with the American Lung Association and a member of the board, or not the board, excuse me, the committee council. And she's just pointing out that the American Lung Association has designated 2019 as the year of air pollution and health. To help raise awareness, they're going to hold monthly events throughout the entire year 2019, whether it's a webinar or some other activity, just to help keep awareness of the importance of this topic about air pollution and how they're all tied together. And the only really public comment that we received was pointed out that Northwestern Energy is due to submit their 20-year and 10-year plan, and if you want to get comments into the PSC, now is the time to do that.
Are you going to do that? Could you, if you made it, are you going to write something and bring it to us?
Not that I know of yet. I
think it might be coming your way.
I think it'd be a good idea.
Yeah.
If you look at it and you feel like, wow, there's worthy of comment, it's hard for me to imagine any of us will pull it together, but if you're on the clock to do that, that'll be great.
Yeah, and one of the things, of course, that they're concerned about is Northwestern Energy has a history of fighting all renewable energy projects and trying to get their 2 cents in for that topic.
They participated at the large climate session and were at the table I was at. It's very interesting.
So,
Lots of reasons.
I've spent years trying to do renewable energy projects here, and with no feed-in tariff, it's almost impossible. You have to have a feed-in tariff with a guaranteed rate to make it work.
Yeah.
So
yeah.
And do you think it's worthwhile to have and take a hard look at that and draft?
Or perhaps there might be a volunteer on the Air Quality Advisory Council that would be willing to dig deep, given the time, and then have Ben review it.
Yeah, and then
Maybe
bring us something to
How would that
sign.
work?
Yeah, I'm not even sure what the deadline is. I haven't personally looked into that yet. So, but yeah, there's a couple of contacts I can make, and we can go forward with that.
Yeah, and if we could bring it to the commissioners too.
Yep.
If you feel like there's a statement that needs to be made, let us know.
I'm sorry, I got so excited and had to brag, but I have to see. I want to see what you guys read. Cool. I want to see that. Thank you. Can I get that from you? Can't help it.
All those are notes.
Yeah.
Okay. I can send you links to that.
Thank you. Let's see if they're the same ones.
Yeah, that's all I have from the finance.
All right. Thanks, Ben.
Once a parent, always a parent.
The next item,
for sure.
The next item on the agenda is the TPCC update.
Yep, I was there, Josh was there as well, he was our ringer for a quorum. I'm non-voting, of course, we've all been through that. So there were a few presentations about Missoula in Motion and a couple other things. The biggest piece of business was some changes that had to be made to the MPO's 5-year plan and unified work plan because of a projected or stated, I guess it's in law now, a rescission in the FAST funding program, which is going to take $7.9 billion out of the FAST program nationwide. So that's going to affect MPOs across the board. And one of the things is that if your money is obligated, then it wouldn't be subject to rescission. And in certain programs, with those monies, they're saved over a number of years, sort of like this department, to do a big project, and probably subject to rescission. So they really did, and we questioned them on what projects might be able to move forward with trail building or other things. A little bit of timing issues, when they found out about the rescission, and that MDT is already in a year that we'd have to take projects to MDT to get a UP number and take it through process and everything and get it. If engineering is completed, get it out to bid, get it under contract so that the money's obligated. And those just are not in a position, even ones that we thought could move forward, it's too risky that we wouldn't be able to get it done before the rescission. And so, which would be September 30. In this case, it's federal money. So it looks like, and it just so happened we did have a presentation as well on the state of Mountain Line resources and where they sit in terms of their useful life and usage and things like that. So what is going to be done, what was approved, was to make a transfer of $1.5 million into Mountain Line there's just some transfer accounts and things to make this happen, but to make the funds available to do bus replacements or new buses with electric units. So that's what we needed to do to preserve the funds. So that was the biggest thing. And I had one takeaway which was interesting to me. In the Missoula in Motion presentation, they mentioned the bike valets and that they're doing, the big public bike parking at events. They did 5 events last year, and I think the number was like they parked like 240 bikes at the Pearl Jam concert. And I had asked the question, so that those bike valet equipment is owned by Missoula in Motion, but it's available for entities to rent or borrow from them for your events. And so I just wanted to let the public know that it might be a cool thing if you're hosting an event to be able to do the bike valets.
So are CMAQ funds, are they subject to rescission too?
It's CMAQ where we made the move.
This was CMAQ funds?
It's CMAQ.
And my take on it was that there was some vagueness to it, that we could say, okay, we sent this money over to buy an electric bus, we're done, we spent it. And they could say, sorry, we got to give it back
So
anyway.
we're worried about the match. So, when we don't, on CMAQ, if we don't match, we lose like 90% of our funds. So what's going to happen?
I did not bring my TPCC file with me,
Oh,
so I don't have it with me,
me.
but it was outlined in the, you can link to it on the SIRE and look at the background to see how it is. It can sit out there. We just have to get it moved to Mountain Line, so it can sit there. We just need to get it moved out of CMAQ, so it's not subject to the rescission.
There wasn't discussion of
Well, it sounds like it might still be
losing
subject to
on it.
rescission.
It might still be.
Here's the problem, is that it could be that MDT does not have the availability to allocate the 1.5 million, that MDT may have all of the CMAQ funds already accounted for because this happened so late that we may not be able to get this in. So that would be really disappointing, because in that, once we find that out and we feel like they'll know that in the next month or soon, that it's even later to try to get a project.
I mean, I could have understood it wrong, but what I thought it was going to say is on the Fed's side, they could take it anyway, or they could not. It was really vague.
Well, it's always at discretion of them anyway.
Yeah. So we gave it a shot. And it fits well with, where the age of the fleet is and things like that.
And the next possible rescission was like in 6 years or something?
Right.
So after this, we can build money up for a few years to try and do a big project, but we just hit the line this year.
Joke's on us.
Yes. What are we doing saving money?
Right. That was it.
All right, thanks Deb, thanks Josh. All right, any public comments on items not on the agenda? Seeing none, board or staff comments on items not on the agenda. Seeing none, we will adjourn as the Air Pollution Control Board. And Deb, it's your call.
We'll try to do it in 5 minutes. So Julie
Okay.
has something that really comes from Ellen, which is a cool visual for the public and for you guys, I guess, to see bouncing measles dots. So as you all know, in 2000, the measles were eliminated from the United States. So good job, team. Good job, country.
For one brief shining moment.
Yeah, because for 12 months, we had no cases. So of course it doesn't mean that it was completely eliminated or eradicated. It just means we just had no places where the disease was appeared to be homegrown. So since then, we've had from 37 cases in 2004 to 667 in 2014. So largely among people who are not vaccinated, of course. So we are currently in a situation where there's 5 active outbreaks in New York, Texas, and Washington. So Washington is close to us. So it is likely coming our way. And like Ellen said, they've already gathered up the team and are starting the process to be prepared for this coming to us. But this sort of like makes me sick. I don't normally talk about health things because that's not what I do, but I cannot believe in this day and age that we're faced with this when it is completely preventable. And it's just really disappointing for me as a person and a mother that that this is out there. So just as an education for the public, this measles is extremely contagious, and it is a virus. I want to reiterate, you do not go to the doctor and get an antibiotic for measles. That's not how it works. So it can cause respiratory, fever, rash. So globally, 110,000 people died in 2017 from measles, mostly under age of 5, mostly unvaccinated. I know, the numbers are incredible. So just some things for us closer to home. 1 in 10 children with measles presents with an ear infection as well, which can lead to permanent deafness in one or both ears. 1 in 20 develops pneumonia, 1 in 1,000 develops encephalitis, and 1 or 2 in 1,000 die. So, this is preventable. I just cannot say that enough. So the transmission is incredible. It is so easy to transmit it, droplets from nose or mouth. If you're in a room with someone with measles, you can inhale the virus, cough, sneeze, breathe, talk. Infected people can transmit measles starting 4 days before they develop or present with any symptoms at all. So you don't realize you're sick, you don't realize you're carrying it, you may not realize that a person in the same room with you had it, and you're able to spread the virus for about another 4 days after the rash appears. So this virus also, we're here right now, it's 3 o'clock, one of us has measles, it gets on the table for 2 hours, that measles that's on the table is transmittable and still alive.
It's actually, it stays there.
It's here. So it's just one of those things, you don't know it's there, you don't know people have it, they don't have any symptoms, and it can just go and go and go. So the presentation just shows what happens in situations where you have a 10% to a 90, basically 100% vaccination rate, and it's just this, this kind of herd vaccination. What you really need in a population to prevent an outbreak is 93 to 95% vaccination. We are not, I didn't get the data from Missoula County Public Schools. I was hoping to find out. In Washington, when they're in outbreak, the schools range from 54 to 72% vaccination rates, which is why they are seeing, case after case after case. There was a new case yesterday that was mentioned here earlier. So.
Well, it doesn't have like a 90% infection rate if you're exposed to it and unvaccinated. It's some unholy
Well,
huge
the
amount.
vaccine's what? It's over 90% effective, isn't it?
Well over. It's a very effective.
But if you're unvaccinated, if you're exposed to it, you're pretty much likely to get it.
Yes.
It's like 90% likely that
one
you'll be
person
infected.
can give it to 7 to 10.
Vaccine is 93% effective. 2 doses, you get a booster. It's 97% effective. So.
What about us old people who probably haven't had a vaccine in 20 years?
So let me tell you, it's not too late. So if it's occurring in your community, it's a good idea to get vaccinated. So a couple of things. If you have all 3 diseases protected against, you should get a revaccination if you were born before 1957, because vaccine became available in 63. But people before 57 are as likely to have measles as children. So just something to think about. You can get vaccinated if you have had an exposure, and it may prevent you, or it may prevent the severity of the case.
It's got a pretty high one of the really neat things, and one of the things in the planning assumptions, is measles does have what we call post-exposure prophylaxis, or PEP. So if you can truly identify those susceptibles and those exposed and get MMR into them within 72 hours, the sooner the better. And so that's one of the planning objectives, is to get the focus and the ability to do that.
Yeah. I mean, just, so this says no symptoms for 2 weeks after being infected. I mean, that's a long time. For you to even think that that's what it is. And in this season, I mean, it presents like a cold. We have cold and flu going around. It looks and kind of feels like that, probably until you get the rash. Fever spikes often in children 104 or 105 before the rash appears. So I think that there's this, concept of herd immunity, that so many other people are vaccinated that I don't need to worry about it.
Yeah.
But we need that vaccination rate to be 93 to 95% in order for it not to be transmitted. So I'm just telling you, we're not high enough here in Missoula County, in our schools, in our community to make that happen. In another herd graph, 17 out of every 18 people have to be vaccinated in order for the outbreak not to occur.
So that's what that red bouncing ball is, actually a measles exposure coming into different herd immunity levels. And so a herd immunity could be defined as what percentage in your daycare or what percentage in your community, but it's more likely what matters is what percentage in your daycare.
Yeah, and there are people that can't get vaccinated for certain reasons. I mean, when we think about the 17 and the 18, it's like, it's okay, my kid's just one. Like the other 17 are, but there are infants, pregnant women, people who are immunosuppressed that can't get the vaccination. It's like our responsibility to be vaccinated so that they can be protected because they can't be.
So I guess my question, which I should know the answer to, but I don't know. So say I had a vaccine 20 years ago, and I get exposed, can I still carry it even though I might not get ill? Like if my vaccine's old, or do I have, is it permanent immunity? Well, that's what I meant. Let's say I was properly vaccinated 20 years ago.
Yeah.
But it's a long time ago, but I've never been exposed to it, so I shouldn't have an antibody titer.
This vaccine is highly effective, and the 2-dose childhood series produces very good lifelong immunity.
Okay, cool.
So if you were in the adult group who was born after 1957 and you got 2 doses in childhood, you do not need to get revaccinated.
That would, yes. Cool.
And the likelihood that you were immune to the measles is very high.
Okay.
I am also not aware of people that are vaccinated getting, kind of a subclinical syndrome where they can carry and spread. You are just immune. You should not catch measles if you were exposed and you've been vaccinated.
Right.
So I was considered immune until the more recent guidance. Even the pre-57s now, so I'm in a series of MMRs myself after all these years.
But for those of us who also travel a lot, I mean, that's a huge piece. I mean, we're going other places. So worldwide, there was an 80% drop in measles from 2000 to 2017, but reported cases of measles have increased 30% since 2016, according to WHO. So it's back up there, and Europe is huge. I mean, Europe has huge numbers of cases because they have a lot of anti-vax
Our last major outbreak here was
Was that Disneyland?
It was during the first Choral Festival, and it was the French. And I remember trying to interpret with the French doctors. Not that I speak French, trying to be interpreted to. And, getting that 72-hour response. And that was before social media. So I think social media could be a lot of noise. Really a lot of noise.
Yeah, so I mean, if you're an adult and you're not vaccinated, if you're a parent and have children that are potentially not vaccinated, it's something to check on and get a,
We give them here.
Yeah, here, your provider.
Thank you.
Yeah, because I am afraid that the next time we meet, we're gonna be talking about cases. So hopefully not.
So I would like to talk about with you a way that we could sit down and share some information maybe with some members of the board in case,
So we have one more order of business, and that would be to
next month.
Get a journal report, volunteer for next month.
Actually, Josh volunteered last
Okay,
month.
great, all right.
And I'm going to be gone in March, but I'm happy to volunteer for April.
Great.
Just to get the process right, am I supposed to pick something timely as you did, or just anything I like, or what are the parameters?
There's no parameters.
I talked about robotic brothels, so.
Right?
I think
It's a good example of what not.
Cemetery pageant has already been taken.
Just to and I believe we already had a board member a few years ago come in and read labels off, catch up from us.
Yeah, and since I already embarrassed myself and my daughter by bribing,
No,
we could even do her art. No, I'm just kidding.
Do I need to bring a copy of the article?
Just for the record.
Oh, you want?
Yeah, just for the record.
You can talk about Juuling and how they did so well, they gave all their employees $1 million bonus.
Who did that?
Juul for the E-cigs.
Oh, yeah.
Every employee got
Yeah.
$1 million bonus, they did so well on sales.
That is sick.
They're a $6.5 billion company now.
Post communication with Abby, who's just tremendous.
Yeah.
Abby's just.
Hey, you know,
Unfortunate.
people like pointing these
There you
things.
go,
Fire
No, and
test.
I would like, I think it just would be really educational.
If they didn't, there wouldn't be fentanyl on the streets.
Yeah.
Here's how we're thinking about this. Here are the
Yeah.
control
Yeah.
strategies and measures
Yeah.
we're thinking
Ross,
about.
we did a
and-
good
That's what I went to the
I mean, because just like,